the rules and the guidelines. This meeting may be conducted at a slower pace just due to some potential lag time from Zoom. If you encounter any technical difficulties, please let us know, and our clerk will take care of that. All participants should stay on mute until they are recognized. And we ask that members of the committee raise your hands and do not use emojis or emoticons in the chat box. And speakers should introduce themselves and identify which bill they are addressing before they speak. And speakers will have 3 minutes after they have introduced themselves. And I don't think we will need it, but we want to remind everyone that there is no inappropriate language during this meeting. And we remind all participants to stay active as possible. We know that can be difficult sometimes during Zoom meetings, but we want to reduce the number of duplicate questions in our discussions. So I will ask if there are any questions before we begin. Alex, are we good to go?
Yes, we are good to go.
Thank you very much. Our first speaker is Mairead Painter, who is our state long-term care ombudsman. Mairead, are you there?
Are you able to?
There she is.
All right, let's see if I can. Don't have an option for a camera, but I can see. It's not giving me a camera option. You know where it is for me to click?
That's okay. During the public hearing, you do not have to be on camera.
So good morning, Senator Hockedal, Representative Garibay, and distinguished members of the Aging Committee. My name is Mairead Painter, the State Long-Term Care Ombudsman. Thank you for this opportunity to testify before you today. And I begin with House Bill 6773, which would allow trained nurses aides and assisted living aides to administer medication to residents in nursing homes and assisted living facilities. While I fully support efforts to improve access to medication, I must oppose this bill due to significant concerns regarding resident safety, quality of care, and the potential for reduced nurse oversight in these facilities. The administration of medication is a clinical task that requires medical knowledge, judgment, and the oversight that licensed nurses provide. While the bill proposes additional training for aides, it fails to guarantee the level of clinical assessment and accountability that licensed nurses ensure. Research shows that delegation of medication administration to aides can lead to errors and harmful drug interactions which pose a risk, especially for older adults managing complex conditions. It would also result in financial facilities reducing the number of licensed aides in the guise of staffing shortages, further compromising quality of care. I also oppose the inclusion of medication-assisted aides being counted towards the 3.0 daily staffing requirement. The job of administering medication is a task and should not replace the direct care being given by CNAs. If this bill must proceed, I recommend limiting the medication administration to residents or, when appropriate, their representative who have elected to have MedTechs administer a limited number of approved medication supports like over-the-counter medications, medicated lotions, suppositories, or diabetic insulin support, while ensuring that any delegation of medication administration does not reduce the licensed nurse staffing and includes strict regulatory oversight for any prevention of financial exploitation. Next, regarding House Bill 6775, which concerns the cost of living adjustment for personal needs allowance for long-term care residents, I urge you to support this change. Connecticut's current P&A is $75 a month, which is not meeting the cost of living. For comparison, Maryland is $102, Florida is $160, and Alaska is $200. The disparity between Connecticut's P&A and other states, especially when considering our state's higher cost of living, is very striking. A modest adjustment to the P&A through Social Security when there's a cost of living increase would allow residents to cover personal expenses like toiletries, clothing, and ensure that they maintain some degree of independence and dignity. Finally, SB 1176, I strongly support the funding for the Long-Term Care Ombudsman Program. Ombudsmen are critical in safeguarding the rights, safety, and well-being of long-term care residents. Research has shown that sufficient ombudsman staffing leads to improved outcomes including fewer hospitalizations and stronger regulatory compliance. However, Connecticut's ombudsman program remains under the recommended one ombudsman for every 2,000 long-term care beds. While there is a significant increase in the complexity of cases and growing demand for our services, as demonstrated by the rise in complaints handled by the program. This is reflected in the surge of complaints handled by our program, which rose from 1,545 complaints in 2009 to 4,413 complaints in 2024. Funding for more regional ombudsmen would improve response times, enhance case management, and ultimately improve quality of care for these facilities. Additionally, it would reduce Medicaid costs by preventing unnecessary hospitalizations and transitions between care settings. In conclusion, I urge the committee to carefully consider these issues. Protecting the dignity, safety, and well-being for residents in long-term care settings is paramount. I hope the committee will reject House Bill 6773 or amend it to safeguard nurse oversight and adjust the personal needs allowance to reflect the true cost of living in our state with regular adjustments married to the cost of living adjustments, and increase funding for the long-term care ombudsman program to ensure effective oversight. Thank you, and I welcome any questions.
Thank you so much, Mairead. First of all, for all that you do for the residents of Connecticut. And of course, we really want to support you with SB 116. I just have a quick question. HB 6775. Do you have an amount that you would recommend that we raise it to? I know you want to tie it to something like an increase in Social Security or something like that, but do you have a starting point in mind that you feel is fair?
I would like to see it start going up by $50, and then every time there's a cost of living under Social Security, have a percentage of that, maybe 25% of whatever the cost of living under the COLA for Social Security, have that be tied to that, and that they would see that every time that we see it federally.
Thank you. I see Representative Jane Garibay has a question.
Yes, thank you. So thank you for all of that, Mairead. I have a couple of questions. I'll try to be brief, but I know that the Ombudsman's office already has a full load and you're asking for extra help. Can you explain a little bit what happens? Your daily load is already at the max, and then when we have a closing nursing home, how do you do that? Because I know you meet with each and every individual person in that nursing home to try to find them a place. How are you managing all this?
So right now, unfortunately, we're having to pull our team members from their regular regions or assignments in order to support the individuals who are experiencing a nursing home closure, and doing our best to triage, which is what's required under our statute and our policies and procedures. It does mean that our other cases are taking longer and longer for us to get to. And I know that individuals in the greater community are feeling that, and we have heard from them. I'm sure some legislators have heard from them as well, that our timelines have been pushed out a great deal because of the focus and concentration that we've had to put on the number of closures or potential closures that we've had, in ensuring that those individuals understand their rights and are also safeguarded.
Right, thank you for that. So not everything is being done the way, you would like it to be because you don't have the time. What do you attribute? You talked about that significant rise in cases and complaints. Can you attribute that to something?
I attribute it to the change in the population of individuals who are currently residing in our long-term care communities. There has been an increase in complexity of cases, as well as education and information. I think people are much more informed about their rights. They have higher expectations related to quality of care and their rights, and they're reaching out for that information. They want us to help advocate on their behalf. They also want to ensure that they have access to the least restrictive environment under the Olmstead Act. And that takes a lot of time for our team members to attend those meetings and ensure that those rights are protected. So that's why I think the number of cases, people, they want to know what their rights are, they want to be protected, and they want to make sure that they have all of the information.
Okay, thank you. I'll leave it at that for now, but Madam Chair, Rep. Valinsky is in person.
Yep.
And he has a
I
question
just
to
saw
at
him.
some point.
Yep. Representative Belinsky, and be followed by Senator Huang.
Thank you, Madam Chair and Madam Chair. I'm going to take the advice of Madam Chair that's running the meeting and zoom in, even though I'm here live, so that everybody out there can see me as well. But Mairead, thank you so much for everything that you do. You have a lot of very substantive comments about the bills that are before us here. I don't yet see that we have your public testimony on the on the system. So I would just remind you and that we in this committee really appreciate working with you collaboratively, and I look forward to reading what your concerns are in working in person with you on finding the place where we should be. That's really all I have, Madam Chair.
Rep. Belinsky, it should have been submitted, so I will double check on that because there are lots of references in that to articles. Our most recent 2024 annual report is in there, and the data related to the the delegation as well as the PNA. So I will double check on ensuring that you have the written copy.
Thank you so much.
Looking forward to
Senator
work.
Huang,
Thank you.
followed by Representative Fortier.
Thank you, Madam Chair. And Marie, so good to speak with you. I've worked with you in the past, not as the ranking member on aging, but in insurance, public health. So thank you for your advocacy and your contributions. And indeed, in reading your testimony, you're one of the individuals that provide extra citations that we can read some more. So I appreciate that. But I wanted to ask you in regards to obviously 6773. I think your statements carry a lot of weight, but I wanted to ask a couple of questions in regards. One, you talked about the potential risk of care erosion. Do we have any data or background in addition to your reference points? And two, have we gotten any input from the Commissioner of Public Health in regards to the possibility of care and quality assurance erosion?
So as far as the Commissioner for Public Health, I would refer you to them to get a statement from them on what their position is. I did reach out to my peers across the country to talk about what this looks like in states where they have it, any concerns. And the concern is related to making those assessments. When an individual who lives in a nursing home or in an assisted living is waiting to see a nurse for their medication, that's usually the 1 or 2 times, 3 times during the day, depending on their schedule, when they interact with the nurse and are seen and are able to discuss any issues or concerns that they're having. The other concern that I have is if someone is saying they don't want to take a medication, potentially because they have a stomach ache or there's something else going on, the nurse has the background and the ability to make an assessment and to look the person over and see maybe they have a blockage. Maybe they look flushed and their blood pressure is high. Maybe there's a reason to hold that medication and call the doctor. An aide or a tech who doesn't have that background and that information unknowingly may still give that medication, trying to do the right thing, following what they're supposed to do. And for that reason, there may be an unintended consequence that would negatively impact that person. And so those are the concerns that I have. And that's why, if anything, I think the lotions or suppository or an Advil, Tylenol type of thing is where I could see that level of support, where you shouldn't have to wait hours because someone's doing a med pass to get an aspirin. But for other things where there's an assessment required or where there could be an impact, even in medications where we don't necessarily know or think there might be an impact, that's where it really requires a nurse to understand that and be able to fully be informed when giving that medication.
No, I appreciate that. And I see in your testimony the constant refrain of scope creep. Having been in the ranking in the public health, I remember during the COVID pandemic, we had that challenge in regards to expanding the scope of allowing non-nurses to be able to administer COVID shots. And I think we eventually passed that after 3 years of conversation and really kind of vetting through as we're doing right now on this issue relating to senior care facilities. Is there an opportunity to kind of be able to work beyond legislative to create kind of a scope of practice and manage some of the examples that you talked about to be able to give greater flexibility and time to our nurses to do the important care that they provide so well, to be able to kind of have some time management? Is there a consideration in regards to a scope of practice to kind of set the parameters that we're talking about, like an aspirin distribution?
Potentially, I guess my concern would be, again, just diluting that specific scope of practice, right? And that we have a very high integrity here in Connecticut for our nursing homes, our assisted living. Our level of public health in Connecticut is extremely high. And I think nationally, we're kind of renowned for that. And I would hate to see us sort of blur that and go in the opposite direction rather than continue to have our high standards and ensure that the individuals who are being served in these settings continue to get the highest level of care for the cost that it is, one, the financial cost, and two, the physical cost. As I said in my testimony, we are seeing higher and higher levels of complexity in a lot of nursing homes. With these high complex care cases, there's a lot of need for assessment and a lot of need for oversight. And so that's where it's a little bit challenging for me, because we are encouraging people to receive their long-term services and supports in the least restrictive environment. And therefore, we are seeing populations of people with higher need in the long-term care settings, which the community offers the ability for someone to self-direct, and that scope is broader. But I don't think necessarily we should change that as significantly in the nursing homes. We should require that continued level of care and that nurse oversight.
Thank you for that. You're always so informative. If I may just, I count back to during the COVID pandemic, and we looked at the incredible burden that's placed on our nurses and the entire structure of senior care facilities. And we saw some of the terrible tragedies in my mind that occurred on to what happened to the patients and the care that's given in our nursing home. So I know we strive for the highest standard, but I also believe in the stories that I've heard that sometimes we fall through. And I think the other challenge I have is one of the critical examples is the ratio and the ability of our nursing staff spread too thin. I think the intent, I hope, in this bill is to be able to allow our talented nurses and critically trained nurses to be able to do more of what is important and allow other people to offshoot the load. But to your expertise, is it a need for a ratio of care, or is maintaining that scope of practice and delineating it so clearly without any possible, additional roles in that, the solution? So there's two parts: increasing medical nursing ratios to account for the need, or allowing some aspect of the scope to be able to offload the burden on our nursing staff.
That's a big question. Well, I absolutely agree with you that there was a tremendous amount of tragedy and impact during the pandemic that I think across the board, as far as Connecticut goes, even though we had a high level of impact, we also had a high level of response, both by our direct care workers, our long-term care communities, and our state agencies responding. But some of the things that we learned were that we need those nurses in the long-term care communities in order to have good outcomes. I do think that there is the potential for, like I said, if it has to go that direction and a resident or the resident representative wants to elect to have someone do some of the tasks related to more over-the-counter or day-to-day things, suppositories, lotions, with some diabetic supports, which are done in the greater community. I could see us potentially getting there, but I struggle with taking away any of the attention or the required staffing in the nursing homes, because what I'm seeing, and I am making visits, I am going out, I am trying to make sure that I'm seeing firsthand what's going on in the nursing homes. And what I'm seeing is the nursing homes where they are appropriately financially supporting individuals, we've seen the nursing staff return. We've seen nursing and staff across the board return when they are provided with dignified pay and working conditions. We're not seeing the struggling and the pinch points for those communities to have individuals return. It's when they don't feel they are being adequately supported and having their individual, or they don't have enough staff on and it makes it dangerous for them, or they're being asked to do things that they think put them at risk. That's when we don't see individuals working there. And I would actually worry about that if you have nurses in a long-term care community where there is delegation or they don't feel there's enough nurses in the long-term care community and it's their license on the line, we might actually see people not wanting to work in those communities because it places them at risk because it is their license.
No, I appreciate that, and I'm so appreciative of your expertise and welcome your guidance on these issues. And even though it's not in this cadre of agenda bills, I think the next time we speak, I think will be raised bills in regards to looking at private equity and its impact in regards to care and management. But I won't belabor that. I just want to move quickly to your thoughts and expertise on House Bill 6775, the PNA and the cost of living indexing. It's quite remarkable to me that we are at 75, and I appreciate the comparative charts that you provided. My question is twofold. One, I think you suggested a $25 increase. One, I know this has appeared in the past. Do we have any idea in regards what the fiscal note is and how long ago any increases have occurred on the PNA? Number two, can you provide to me or the committee leadership an opportunity of a comparative of neighboring states, such as New York, Massachusetts, Rhode Island, and New Jersey as a comparative? I'm seeing Florida, Alaska, Arizona, and even these low-cost states, quote unquote, are higher than ours. I can only imagine what it must be as a comparative. Maybe you know right off the your expertise of knowledge what some of those rates are for neighboring states with the same comparable cost of living.
I can absolutely get you our neighboring states. I do believe at least a few of them are higher than us, but I will get that for you. Part of the challenge was a number of years ago, I want to say it was 10, 15 years ago, there was a reduction. We had a personal needs allowance that was closer to $70, and then we had a temporary reduction, which was supposed to be for 2 years, 3 years, and it never went back up. And then it was very low, I believe around $50. And it took us years to get that back up to 75. And that was only done a few years ago. What we see in other states that we don't see here in Connecticut is when you're talking about the fiscal note, we're not asking that it come out of the general fund. We're asking that when there is an increase from the federal government in someone's Social Security, so if someone's in a nursing home and they receive Social Security, and that Social Security goes up by a cost of living, people get a cost of living increase, that when that cost of living goes to the individual, they only keep $75 of it right now. We're saying we'd like them to be allowed to keep a little bit more of that, set 25% more. And so there isn't a fiscal cost to the system per se, because we don't know when those are going to come and we don't know how much those are going to be. But what it means is the state would apply less of that annual or whatever, whenever it comes, that COLA, cost of living, to the person's care, and they would keep 25% of it to go to their personal needs allowance. And we thought that doing it that way really ensured that it didn't come out of something that the state was already paying or out of the general fund, but it's directly tied to when they see that there's been a change in the cost of living nationally, that the individuals in long-term care are also respected and provided for in order to meet their daily needs.
Okay. I appreciate that, and I do think it is woefully low. And I know sometimes in the committee of cognizance, we know much more, and we articulate kind of inside the beltway. So as a new ranking member, I studied up on it, but what people need to a lot of the general public may not understand what a P&A allowance is, and it is for kind of personal needs like toiletry, toothpaste, hairspray, and things like that. That's not covered by the facility. Would that be correct? Maybe you can articulate a little bit better for the general public what the P&A allowance affords, because I can tell you, these kind of things, as I work with, our pantries and our community outsource and providing goods, one of the biggest asks for many of the people in the community are personal needs products, toiletry, and things to that effect. Can you explain a little bit better for the general public that may not know what a P&A is and what the allowance does?
Totally. So the personal needs allowance really covers everything. Haircuts. Haircuts are $25, let's say. So if a gentleman gets a haircut once a month, that's $25 out of their personal needs allowance. If they want a can of soda, so recreation will often sell things like snacks, in addition to what is provided day to day. They will do takeout. So recreation might have a restaurant where they do takeout twice a month. That comes out of the person's personal needs allowance. So that may be $10, $12, $15 if you order a meal on takeout. Having a cell phone, right? Some long-term care communities, like you said, your toiletries, your clothing. So bras, underwear, a sweater. If the machines in nursing homes they're industrial machines, so clothing gets impacted and people need to be able to restore their clothing. All of that comes out of that $75 a month, and it really doesn't go very far.
No, I appreciate that, and for me, it is I'm trying to study up and learn as much as I can to my chairs and colleagues in the committee that I found the P&A cost to be so low when you put in the normal cost of living that's outside of the facility. So I appreciate that, and being able to get the comparable numbers would be very helpful. So again, thank you very much for your help. I'm sure that in other raised bills, we'll seek your expertise and insight. And again, I want to thank Madam Chair for the indulgence of asking some of the questions that I did. Thank you, ma'am.
Thank you for your question.
Thank you for your work, man.
And we will go to Representative Fortier.
Thank you, Madam Chair, and thank you, Mairead. I echo my colleagues thanking you for all you do. We do appreciate the work that you do. We know it's important. Following up a little bit on 1176, the chair, Representative Garibay, was talking about, what it is you do. And as a representative representing Bristol, 2 of our nursing homes are in that process of closing, and I do want everyone to understand it's a process. There's reports and hearings and evaluations by DSS. In my case, these 2 facilities, the owner is asking that he be allowed to close the facilities. And again, it's a process and it takes months. You mentioned in your testimony in response to Rep. Garibay, that other things are not done because of the time that you have to spend with those residents, getting them situated in new facilities. Can you give us an idea of how many facilities have gone through that process, let's say in the last year? I know some have closed, some may still be in the process of closing because it is a months-long process. But how many facilities have closed in the state in about the last year, if you know?
So the certificate of need process, which is when a nursing home or residential care home comes to the state and says that they want to make a change or close. And that is the process in which then my team is engaged in going in and ensuring that the individual's rights are protected. I think that, I'm just looking to see if one of my team members maybe have sent me anything on that. I'm counting off the top of my head here, 1, 2. We have had, I would say, that have gone all the way through 2 or 3, but that also happens when there's nursing homes that then are sold. So part of the process is when nursing homes are sold to another company, because we have to ensure residents' rights. So it can, I would say this year we've probably had closer to 7 or 8 where there has been an impact related to that significant change in ownership, not a normal change, but where there's been a high risk of either a potential closure or an actual closure, and now a certificate of need requesting to close, when we have to spend usually 1 or 2 team members there on a daily basis, meeting with every individual to ensure that their rights are protected.
Thank you for that. And based on your experience, do you see the potential for more facilities? In other words, do you see facilities at risk currently in the state that you could see that happening in the next year, and about how many, again, if you know or can let us know?
The challenge is that nursing homes in Connecticut are all privately owned. And so it's very hard to make that prediction because private owners can make arrangements with different buyers. We don't always know that. We may have skilled nursing facilities where we have concerns or we think that there may be changes, but it's really just a guess. We work with our sister agencies and our partners to try to ensure that high quality of care. And then it can happen very quickly. There's also the Center for Medicare and Medicaid, which has guidelines in place, and sometimes they determine that there's such a high level of risk that they make determinations, and then we have to respond to that. So it's really hard to say what that might look like and the timelines and who might be involved, but you know, we're there to respond whenever
Yeah.
things happen, whether it be an emergency. And I just want to highlight, but I have 8 team members regionally. I do have 1 regional community ombudsman who can provide support. But when this happens in 2 long-term care communities at once, and then we just had another one just before it, you know, if you have 3 potential closures or CONs happening at the same time, when the entire staff is 8 or 9 people, it really does draw upon our ability to respond to other critical incidents and actions happening in other places and be able to support other residents.
Right. And I appreciate that answer. I know that you don't want to speculate and guess, and I do appreciate that. But do you see that this process is over, that you don't anticipate there being any more in the next year?
No, I
Okay.
would anticipate seeing some others. My hope is that nursing homes maybe downsize in beds, because I would really like to see a lot of long-term care communities in as many towns as possible. I don't love seeing huge ones like 200-300 beds, but I've testified to it a lot of times. A 40 to 60 bed nursing home in a community where individuals get to stay in their communities of origin, people from those communities of origin are working there. That's when we see the best outcomes, because you have the people that you know, that you see in Stop and Shop, that you interact with on a regular basis, caring for the people in their community. And that really brings about good outcomes for individuals. And they get to participate in the greater community at a higher level. And I'm really hoping that our long-term care communities start to diversify and provide supports and opportunities within our communities at different levels of care, so people really have choice in where they receive their long-term services and supports.
Thank you. Appreciate again all you do and appreciate you
Thank
being
you.
here. Thank you.
Okay, any other further questions? Seeing none, Mairead, again, thank you for all your work and all your suggestions. Definitely improving the lives of our aging population. We appreciate you.
Thank you very much. Have a great day.
You too. All right, next we have Michael Warner.
Hello, can you hear me?
Yes, we can. Go ahead, please.
Okay, very good. Hello, everyone. My name is.
Oh.
Pardon me. My name is Michael Warner. I'm the lead aging policy analyst for the Commission on Women, Children, Seniors, Equity and Opportunity. Good morning to you, Senator Hockadell, Representative Garibay, Senator Huang, Representative Belinsky, Senator Miller, Representative Fortier, and other distinguished members of the Aging Committee. And I'm here today to talk in support of Senate Bill 1176, an act concerning funding for the Office of the Long-Term Care Ombudsman and area agencies on aging. And in addition to my role as the lead aging policy analyst, I'm also the administrator of the Long-Term Care Advisory Council. And over the last few years, we've really honed in and developed 3 pillars to help strengthen our community, our aging in place initiatives, and they include family caregiving support, oral health, but also supporting the long-term care ombudsman program. And Representative Garibay joined us this past December and really highlighted the importance of choice and quality. And that is what our ombudsman program does. And a session or two ago, Senator Huang aptly referred to the ecosystem of our aging in place services. And that's something that we really want to hone in on. And when we think about also some recent attention by the legislature, we've heard about really a need to also address senior fraud. And what's great about the Ombudsman program is that it helps with prevention. And really, when we talk about issues of older adults wanting their rights protected, what happens during escalations with law enforcement and with prosecutors, they become reluctant witnesses. And what the ombudsman can do is help with mitigation and really strong prevention work, remediating issues. They have the ability as non-mandated reporters to go in under the direction of the individual receiving services to help guide what their needs are, but also to make sure that everything is going correctly for them. And if there is a need for escalation, then they can certainly do that. Only about 1 in 24 crimes against seniors end up being reported. And so that's why really putting a lot of attention into this. I know there's a couple bills coming up through the Aging Committee 5795 and Senate Bill 13 that also look at this issue. But I think really incorporating the ombudsman into that understanding is critical. Funding for staff for the ombudsman is supported by the Long-Term Care Planning Committee. They just put out their annual, their 3-year report, their 3-year plan. Our Long-Term Care Advisory Council supports it. The Alzheimer's Disease and Related Dementia Coalition supports it, as does the Comptroller Healthcare Cabinet. We heard a little while ago in the conversation with Rep. Fortier that they have, 1 state ombudsman, 8 regional ombudsmen. They have some administration intake and also a community ombudsman with another regional ombudsman there. But really what we need is to fulfill all 8 regions on both sides so that we can have a fully funding of this program. And so this bill goes strongly towards that. We appreciate that. We also would recommend the addition of a distinct $20,000 for new software for them to help with their intake and their administration on the community ombudsman side. And we also appreciate the attention given towards the navigators. They're critical for onboarding our older adults as they apply for long-term services and supports. So we really want to thank you for raising these important concepts. Thank you very much.
Let me thank you for your testimony and for, again, helping our aging population. Is there any questions from the committee? I am not. Oh, I have Representative Garabay. Go ahead.
No, I just want to thank you, Michael, for coming and for always being out there advocating for our seniors and doing such good work. Thank you.
I thank you kindly, Rep. Garabay. I certainly appreciate your leadership and the leadership of Senator Hochdahl and the rest of the Aging Committee. You guys do such tremendous work in bringing forward these important concepts, and our older adults are very lucky to have you in these roles. And so we remain grateful for all of your leadership. Thank you.
Thank you for the kind words. Seeing no other questions, thank you and stay safe on this snowy day.
Thank you.
Next, we will have Walter Blum. I hope I said that correctly. Mr. Clerk, do we see Walter?
Yes, he's here in person.
I am here in person, and yes, you
Perfect.
pronounced it correctly.
Thank you. Go ahead, please.
All right. Good morning, everyone. Madam's co-chair, Representative Belinsky. Good to see you here in person, members of the committee. First, I want to assure you all that I was not driving 70 miles per hour as I came in this morning. It was bad out there. My name is Walter Glum. I am a senior. I am a parent of a young man with developmental disability who's actually here with me today because his work was canceled. But I am also here testifying as the executive director of the Connecticut Council on Developmental Disabilities. I'm here in support of raised bill number 1176, especially funding for navigators at the area agencies on aging. I want people to appreciate that nowadays, and I think more and more, the array of benefits that are available to people as they age can be complicated, and people need help understanding these things. Those of us who have family members with disabilities who themselves receive Social Security, Medicaid, and Medicare, many of that population are duly eligible, especially as they age. There's even more of a need for knowledgeable navigators to help people understand how these various benefits interact. I am eligible, but I'm not yet receiving my Social Security or Medicare benefits, but in time I will. And when I do that, how will that impact my son's benefits and so forth? It's not a trivial situation. So the navigators at the area agencies on aging are invaluable to individuals, older individuals who are trying to sort out how best to manage their benefits package, what the impacts are going to be, what choices they should be making. And I want to note that I think we all know changes, perhaps dramatic changes, are coming to Medicaid and perhaps also to Medicare. At both the federal and the state level, we see proposals for significant changes to Medicaid. And that's going to just increase the need for good information and more navigators. And again, for older adults, so much of that falls on our area agencies on aging. You can bet that 6 to 9 months from now, there will be a surge in need, in requests from older adults for help understanding the new rules on Medicaid. Are we going to have per capita caps? Are the reimbursement rates going to be lowered? Again, how does that impact the interaction between the different benefits that you're receiving as an elder individual and that the interaction with the benefits that your children with disabilities might have? So I encourage you to pass this bill 1176 and give the area agencies on aging additional resources so that they can do the job they need to do. And that's my statement. Thank you very much.
Thank you so much. And thank you for you and your son coming to the Capitol in person. You're very, very brave to weather this storm. We do have a question from Representative Belinsky.
Thank you, Madam Chair. It's probably a little bit less of a question than it is a statement. Mr. Glum, thank you so much. It's a pleasure to deal with you and your advocacy across different spectrums. Your work is invaluable. The comment I'm going to make is that the warnings that we hear about the uncertainties of future funding are obviously very, very real. As a state, we do an incredible job of helping folks navigate many, many parts of our state, benefit system, particularly in Medicaid, in many, many areas, but aging is not one of them yet. When we take a look at the way we're, handling it through public health and, in regard to other areas of need, this is a very, very, very necessary investment. The Ombudsman's Office and the navigators that work through our area agencies on aging, which, by the way, we do have proposals for, which are before us here, need to be seriously considered so that the care that we give to our aging population is comparable to the care that we're giving to our other populations. So thank you so much for all of your advocacy for all of these years, and for your being such an outstanding caregiver on top of everything.
Well, you'll have to ask Nick about that, but thank you.
Smiling.
Thank you, sir. Are there any other questions from our committee members? Seeing none, thank you again and safe drive home. Have a great day. Next up, we have Allison Dvorak. Also in person. Thank you so much.
Yes, I don't know if it's a testament to commitment or just a little bit on the wild idea, but it was a drive-in and I'm glad to be here. Thank you so much, Aging Committee members. My name is Allison Dvorak and I'm the Director of Senior Resources, which is the area agency on aging in Eastern Connecticut and also a part of Aging CT. I'm here to support Bill 1176 to fund the service navigators with the area agencies on aging. With the support of the legislature, the existing service navigators are doing tremendous work to help people, caregivers, colleagues, and municipalities across every inch of the state. Each service navigator helps at least 30 people per month in very intense and complex ways. We currently have 2 navigators at my agency utilizing the state funding that was approved last year and some remaining ARPA funds. Those 2 are doing vital assistance to provide help to people in so many different ways. Most times, these are the people that are facing the most challenging barriers to helping themselves. So they really don't have assistance available to them, nor can they just understand how to read the paperwork that sometimes comes to their mailbox. So they face isolation, literacy concerns, loss of loved ones who might have handled the paperwork before, beginnings of dementia, mental health issues, and potential exploitation because of all of those reasons, and so many other reasons why our assistance and personal attention to them is so important. I'd like to give you some examples of individuals that we have helped with this type of assistance. One recent was a mother, an older mother, caring for her permanently disabled adult child, who then found out as the mother that she had a terminal illness. The mother needed assistance with planning continued care of her daughter, estate planning, transportation for her own medical care, and grief management, just to deal with all of that coming at her at once. The mother eventually passed, and due to the appropriate planning, the disabled daughter can remain in the community with supports. Another example is a woman with a rare diagnosis that impacted her physical and mental abilities. We were able to help her apply for Medicaid, which is not easy to do, advocate to be covered on the mental health waiver, and coordinate long-term support services in the community to provide personal care, in-home counseling, home-delivered meals, and a case manager. Almost all of our cases require multiple interactions with clients, as well as follow-up to ensure the needs continue to be met. The actions keep people out of skilled nursing facilities, thus saving significant state Medicaid dollars. The area agencies on aging are nonprofit agencies, so the cost of providing service is lower with minimal overhead or fringe expense, but we absolutely love what we do. Our extensive partnerships throughout the region generate referrals in addition to managing the calls that come into our agencies for many reasons. Somebody may just call with one question and it may lead to a more complex intervention with them. Our current call volume and caseload exceed our staffing levels without even advertising yet. We are asking for funding that would continue and expand the service navigators at each of the area agencies on aging. We hope that this funding would provide up to 4 service navigators at each area agency on aging, and this will allow us to serve more people to help where they need us and when they need us. And I like to point out that we do serve every nook and cranny of Connecticut. So some of our smaller towns, I know my area has a lot of smaller towns, we can help them when they need us. I want to leave you with a quote from one of our clients. Quote unquote, "You have a knowledgeable, compassionate way about you that helps me feel there is hope and there are going to be solutions." So I thank you for listening today, and I'm here to take any questions if you have them.
Thank you so much, especially for those individual stories. They're so powerful, and I agree with whoever quoted you. We thank you for your hope and your solutions. Rep. Belinsky has a question.
Thank you so much, Allison, for everything that you do. Just a quick question, so that people in the general public can hear this. How does one access a navigator when they, hit the proverbial wall and don't know where to turn next?
There are a lot of ways. Of course, they can call our agencies. We do have an 800 number, and I'm blanking on what it is off the top of my head, but they can reach us that way. Sometimes they reach us through a neighbor or a senior center. They might connect with them. Many times we're connecting with a municipal agent for the elderly who may get that first call and says, "This is, more than I can manage. Let me bring in the service navigator to help me through this." So we take them in any different way. The calls can come in, or a referral from a person or a colleague agency.
Do you think that it would benefit members of the state and the justification or the critical mass of the area agencies if the state somehow invested a little bit of money in promoting what you do? Or could you handle the volume? Probably not in your current state, but.
So I do agree. I think we need to, do more to advertise what we do, and we're thankful for some funding that was made for that purpose, and we're working with our marketing group to do more outreach related to that. It's a challenge with the time that we have to work on that. We don't have a marketing department, and do more. But so the more would also be better. The challenge we sometimes face is the programs that we help people with. It's not just that time of the service navigator, which is so important, but that service navigator being so knowledgeable about all the other programs, we're getting them into the right ones that they need. And some programs, such as the National Family Caregiver Support or Meals on Wheels, or some of these other federally funded programs, have limited funds, and so we can only help so many people so far with those. But we're very thankful for the support that the state does supplement those programs so that we can make them go further.
Thank you. I'm very grateful for the support that in your small state right now you are providing, because for everybody who doesn't already know this, the state's doing the right thing and the initiative for aging in place. But there's an awful lot of information out there, and how to digest it is something that the navigators are absolutely invaluable for. So what you do is tremendously important to the well-being and the betterment of aging in place and aging in general in Connecticut. And I thank you.
Thank you.
Thank you, Madam Chair.
Thank you. Rep. Garabay.
Yeah, I just wanted to say thank you, Allison, for coming to testify today. I know we saw that need last year in aging, and we were able to fund the area agencies on aging monies to use for promotion, so that people are aware of the great work that you do. Because from what I understand, a lot of the funding that they receive cannot be used for promotional purposes. So, but if no one can find you, so it's good, and you're all doing a wonderful job. Thank you.
Thank you. And we really appreciate your support. And, we've had some great support at our last 2 years. We have an Aging CT Summit, and that's really grown to where we're going to continue that and continue to work to spread the word about the assistance that can be found at the agencies on aging.
Thank you again so much, Allison, and for coming in, and please drive home safely.
Thank you.
All right, next up, we have Rachel Boxwell from the Yukon Health Center.
Good morning. Are you able to hear me?
Yes, we are. Thank you.
Excellent. Good morning, Aging Committee members. My name is Rachel Boxwell, and I'm an outpatient licensed clinical social worker at Yukon Health. I wanted to take this time to share my experience with the service navigators located at the area agencies on aging. I believe this to be a vital service, and I hope you will keep this in mind as you consider raised bill number 1176 and future funding for this program. On average, the referrals for financial assistance and insurance issues received by my team at Yukon constitutes over 25% of our total referrals from our outpatient providers. Most of our patients are older adults, and many have disabilities. Most have had little experience with the healthcare and health insurance systems. As an outpatient social worker, my role is to provide information on the highly technical, complicated, and confusing resources and benefits available to them. But due to time constraints, I am unable to assist them with completing applications or pursuing the benefits I describe. Unfortunately, many patients don't follow through on the applications because they lack the physical or cognitive ability to do so. The service navigators are the critical bridge between the needs identified by medical providers and the resources identified by social workers like myself. I would like to share the experience of one of my patients. In 2024, an 86-year-old man was referred to me by his primary care provider for quote-unquote financial concerns. This patient was still working as a driver for students with disabilities, so he could support himself and his wife, who was battling stage 3 cancer. Despite his advanced age and medical conditions, he had no other choice but to keep working because of the high cost of their health insurance. Costs that were especially high because of his wife's cancer treatments. I screened the patient for benefits and programs, explained to him what he is eligible for and how to apply. Unfortunately, between the online system and the amount of paperwork required, my patient was overwhelmed and unable to complete the application process. This patient was referred to me another 3 times for the same concerns, amounting to a total of 4 referrals in a 13-month span. Around the time of the 4th referral, I had become aware of the service navigators, and I encouraged this patient to reach out to NCAAA. The patient did so and was connected with Diana, who began a full-scale review of their healthcare needs and costs. Ultimately, the consumer saved $185 per person, himself and his wife, per month in Medicare premiums and copays, and another $389 per person per month for a right-sized health insurance plan. This was a total savings of $1,488 per month. Plus, they are now saving money on groceries with their brand new SNAP benefits, also obtained with Diana's assistance.
Your 3 minutes are up. Please summarize.
This was absolutely life-changing for my patient. He was able to quit his job and retire at the age of 87, and it wouldn't have been possible without the service navigator. I hope you'll consider this patient's story and the impact of the service navigators as you review the raised bill number 1176. Thank you so much for your time.
Thank you, Rachel. And of course, as I mentioned before, hearing those personal stories is just so powerful. So we thank you for that. Does anyone have a question or comment? I am not seeing anything, so thank you again for your testimony and have a great day.
Thank you. Same to you.
Next up, we have Tracy Wodach from the Connecticut Association of Healthcare at Home.
Can you hear me okay?
We certainly can. Go ahead, please.
Great. Thank you so much. Senator Hockadell, Representative Garibay, Senator Wong, and Representative Belinsky, as well as the distinguished members of the Aging Committee. My name is Tracy Wodach, President and CEO of the Connecticut Association for Healthcare at Home. I'm also an RN with over 40 years experience. The Connecticut Association for Healthcare at Home is the united voice for our licensed home health and hospice agencies, as well as several homemaker companion agencies. Together, our members provide services that foster cost-effective home care for Connecticut's residents in the setting they prefer most, their own homes. The association and its provider members are always supportive of efforts that can lead to expanding access to support services in the home to encourage aging in place. Recognizing that Senate Bill 1177 and House Bill 6772 are looking to do just that, I'd like to take the opportunity to comment on those bills as currently drafted. Until the chronic underfunding of Medicaid reimbursements for our home and community-based services is adequately addressed, studies to determine the needs of the aging population would be too little, too late. While it's important for long-term planning and included in the 3-year long-term services and supports report that Michael Werner mentioned earlier, we don't have enough staff presently to care for the current needs of this population. A study would likely tell us what we already know. Without significant investment to address the chronically low Medicaid rates for home and community-based care, this problem will only continue to worsen. Senate Bill 1176 proposes to fund positions for an ombudsman and aging service navigators in unspecified amounts. While we strongly support that goal as well, any funding should first be directed where we already know needs significant investment to ensure this population is served. Please support the funding system that ultimately will be the care providers for those with future aging needs while simultaneously determining the long-term needs for our community residents. Over the last 17 years, we have not had a meaningful increase to keep pace with rising costs. And unfortunately, the biennial budget that Governor Lamont released yesterday did not address these much-needed funds. Both the skilled home health and the non-medical home care providers are struggling daily to recruit and retain staff due to severe underfunding. Nurses and therapists have been leaving home care to obtain higher-paying jobs with better benefits in the institutional settings. The self-directed PCAs received a 26% increase in wages last year without any consideration given to the agency-based homemaker companion model. These pressures are increasingly rendering our industry ill-equipped to compete for the workforce necessary to serve the needs of our senior citizens in the place where they want to receive their care, in their own homes. Thank you, and happy to answer any questions.
Thank you, Tracy, for your testimony. Representative Fortier has a question for you.
Thank you, Tracy, and thank you for the work you do. I want to just drill down. Are basically all of your members, workers, funded through Medicaid rates?
Not all. We are funded through a variety of payer sources, Medicare for our skilled home health and Medicaid.
Okay.
Some of the Medicare, more than 50% really is Medicare Advantage, which pays about the way Medicaid rates pay. And then our homemaker companion agencies are either funded by private pay through consumers in the community or by the Medicaid state-funded programs through the Connecticut Home Care Program for Elders. And several of our providers in that area have a significant volume of Medicaid state-funded.
Okay. But I think for our purposes, it is Medicaid funding.
Yes.
Because we don't have any say over Medicare funding. As you know, and I don't even mean this committee, but I mean the General Assembly. The area that we can make a difference is raising our rates for Medicaid. Would you agree?
Yes, I would absolutely agree with that.
Okay, so I hope to see you in Human Services when we bring these issues up as well. Because it is a chronic problem, and it we saw with
Agree.
COVID and
It's
everything
an
else that it affects the workforce and obviously ultimately the care. And while all of us on this aging committee, I believe, support that, it is the Human Services Committee in terms of the actual rates. But go ahead, I feel like
Yeah.
I interrupted you.
I'm sorry, I probably interrupted you. I had an unstable internet. I truly appreciate your comments and the work that the Aging Committee does. And I don't normally bring the Medicaid funding piece toward forward to the Aging Committee, but it does go hand in hand with your agenda items to really look to the needs of the seniors and the aging population in the community. The Ombudsman program, the service navigators, all that all go hand in hand. And if we don't have a workforce to be able to manage the volume that is needed in the community, then we would not be able to sustain your goals or meet your goals. So
Right.
thank you very much. And I will be testifying before Human Services.
Thank you.
Any other questions for Tracy? Seeing none, Tracy, again, thank you for your advocacy and all you do, and have a great day.
Thank you.
Thank you. Next, we have Beatrice Torres from the Western Connecticut Area Agency on Aging.
Good morning, committee. My name is Beatrice Torres, and I am the lead service navigator at the Western Connecticut Area Agency on Aging. Today, I'm here to testify for Raised Bill 1176. I'm here today to advocate for continued funding for the service navigator positions, which are essential for us to continue providing the effective, person-centered support that our communities need. As a service navigator, I play a critical role in helping individuals access service, navigate complex systems, and connect with necessary resources. In many cases, people in our communities face barriers like language, lack of transportation, and are unfamiliar with services available to them. The service navigator position is the bridge that connects them to vital resources such as healthcare, housing, legal assistance, and in-home care programs. Without the funding to sustain these positions, many individuals would face continued struggles in accessing the support they require. One example that stands out for me is an elderly couple who reached out to me after their home had been foreclosed on. They were both physically impaired, and for months they struggled to find safe housing. I worked closely with Protective Services for the Elderly, Meals on Wheels program, local motor lodges, and nonprofit homeless outreach programs and private management companies to secure them affordable housing and to ensure that they had a hot meal every day. They spent several nights sleeping in their vehicle when they ran out of money. It's been 7 months and they are safely housed, and we are working to get them in-home services as they need it. This is just one of the many stories that illustrates the tangible difference a service navigator can make in someone's life. By investing in these positions, we are not only meeting the immediate needs of vulnerable individuals, but also contributing to long-term community stability. This investment helps reduce healthcare costs, prevents evictions and homelessness, and combats social isolation, and reduces overuse of other community resources. In conclusion, I urge this committee to prioritize funding for the service navigator positions. These roles are crucial for ensuring that most vulnerable community members have the support and resources they need to thrive. Without this funding, we risk further isolating individuals who are already struggling to access essential services. Thank you for your time and consideration.
Thank you, Beatrice. And I have to tell you, I almost cried during your testimony because I cannot understand how we can have homelessness among anyone in the state, but especially our elderly. And it absolutely breaks my heart. You do have some questions. First from Representative Belinsky. And then
Pitch
from Representative
Chair,
Hughes.
for taking the opportunity to, from your busy day, to testify before us and for what you do. If I had to ask you a question about what's changed in the world of senior care, what does your caseload look like relative to just a couple of years ago? Is it increasing? Is it holding the same, or is it decreasing?
My caseloads are increasing. I am finding that there are more seniors in need of housing and just navigating the long-term services and supports. There's a lot of individuals on my caseload that don't have familiar family support and require full hands-on from beginning to end with navigating services.
Thank you for that. It's worth noting that Connecticut's amongst the 5 oldest states in the nation. I don't mean chartering or our Constitution. We do have a need to adjust to the fact that demographically we're an aging state, and the need is not decreasing; it's actually increasing. We need to keep that in mind and be equitable in the way we treat the people that have allowed our state to get to be the great place that it is. So thank you so much for your testimony. Thank you for your devotion to this important work. And I am finished for now. Thank you, Madam Chair.
Thank you.
We also have Representative Hughes has a question.
Thank you, Madam Chair. Thank you, Beatrice. Your one example is so compelling. I was wondering if you had any other examples of what it really saves to keep people in their own home, because the example you gave was clearly how critical the navigator is needed to, ultimately find services and housing, which is very, very difficult for people that are either evicted or foreclosed on. I was wondering if you have any examples in the trenches, literally, of, saving those steps and costs of intervening earlier upstream, if you will, to trying to keep people housed and safe. If if any of those cases come across your caseload.
Thank you, Representative Hughes. Usually individuals are reaching out to us when it's either far in the process of eviction or when they are in dire need of help and they need it tomorrow. And as you know, Connecticut Legal Services can only do so much with individuals, and they have their income limits for who they help. And for the individuals who we try to keep in the home regarding the need of home care, it's very difficult because the process to get them onto Medicaid Title 19 services can take up to 6 months. And it also is pending if they have that support to obtain verifications and documents that they will need for Department of Social Services. So usually when they contact us, it's because they need the help right away, and it's a little bit late in the process.
Sure. But doesn't the Area Agencies on Aging theoretically offer case management services for everyone who's eligible, whether or not they're in crisis?
So case management services is no longer a part of what is provided through service navigation, but
Got it.
We do provide options counseling, which is person-centered supports. We do planning, what the client's needs are, what their wants are, what the goals are, and how we can go about reaching those goals.
Great. So if you had a magic wand and said what you think the magic caseload looking forward for a navigator position, how many more positions would you like to see to address the need that's out there?
I'm going to go with what Allison from Senior Resources said. Right now, we currently have 2 service navigators, myself and another staff, but I think we would benefit from having 2 more service navigators so that, the need that we're seeing, the increase is met.
Great, thank you. And I think, the costs of that would benefit the state in saving so much more in, crisis costs. And, like you said, I know from working in case management, when you're putting up people in, crisis hotels or whatever for emergency housing, it costs the state a lot. So if we could, prevent some of these crisis costs with navigators, we would save the state a lot of money. So thank you. Thank you, Madam Chair.
Worse, thank you. It almost sounds like we need presumptive eligibility for this issue as well.
Indeed.
Any other questions for Beatrice? Seeing none, thank you so much for your testimony and have a great day. Thank you for all you do.
Thank you.
And I am going to apologize for the next name already. Marcelia Martinez.
Yes. Good morning, everyone. My name is Marciela Martinez, and I am one of the service navigators with Beatrice at the Western Connecticut Area Agency on Aging. And I'm here to explain why we should continue to fund this important role. So I moved to Waterbury, Connecticut from Philadelphia last year of 2024. So I'm practically still new in this role, but I quickly recognized the significant need of our elderly population. So as a social worker, my role is to assist clients who face multiple barriers, such as accessing long-term care, home care needs, dealing with abuse, whether it's self-neglected or if exploitation is happening, from cases like food insecurity, isolation, housing issues, and even from caregivers who are stressed and unaware of the services available to their families. So most of our job that we do is mostly us engaging too in problem solving, trying to screen clients for services, trying to collaborate with other professionals like therapists, doctors, any healthcare providers to bridge the gap and prevent the recurrent issues. So as people age, we know that it's hard, for them to be, as they age, they often become more like dependent and vulnerable, and they need to know that they can count on a trusted professional, and that's us. We serve individuals who are marginalized, who are ignored, and often they're far from their family or community support system. So my role is just not serving people in the call center. It's about making sure that those who need help the most, they aren't left behind and they have someone advocating for them. For example, I have a case, I'm working with a 75-year-old male client. He lives alone. He has a monthly income less than $2,300. He was diagnosed with social anxiety and depression, and he has no family in the Southbury area. And he recently went to a specific center and he felt unaccepted because of his age and because of his sexual orientation. And he called me, he had difficulties trusting others. And when he first called me a couple months back, he needed help with his Part A and Part B premiums, and I helped him with the QMB application assistance. And then I helped him to connect with the senior center. And now he found a friend there that picks him up for appointments and trying to help with his social anxiety and helping him find the connections that he needs. And recently he called me because his bill was a little high, his electric bill, and he needed help calling, a supplier. So I helped him find a more affordable electricity supplier, and now his bills are low. So my role is important. I take it serious. And my role is crucial for supporting individuals like him. And this is just one of many stories. And I just want to leave you guys with this. Nobody cares how much you know until they know how much you care. And that's what we do. We care and we go above and beyond. And I'm one to advocate. I will send them, okay, send me, I'm gonna send you a disclosure form. And, I want to reach out to your therapist. I want to reach out to your doctor. What can we do so we won't have to repeat these cycles? And that's why I believe the funding should continue for our department. Thank you.
Thank you so much for your testimony. You have a question from Representative Fortier.
I appreciate your work. As we've said to all of our callers, you are doing very important work for the state of Connecticut, and we appreciate it. I'm sorry, I'm a mom and I have to add things. Does this gentleman that you refer to qualify for reduced pricing for his utility bills? I know there's obviously picking different providers, but we also have programs when you're low income that you can get a complete rate reduction, a percentage off your bill. Just making sure he's signed up for that as well.
Yes,
Appreciate it.
he is. He's with the Energy Assistance Program as well, so he's connected to that as well.
Great, thank you so much. Does anybody else have a question or comment? Seeing none, thank you again, and have a great day.
Thank you.
Thank you. Next, we have Mag Morelli.
Hi, can you, oh, sorry, excuse me. Can you hear me?
We can hear you, Mag.
Okay, I'm sorry. It's just done a little bit differently than normally. I don't think I can show my camera, so I will just speak. Good morning, or now it's good afternoon, Senator Hockadell, Representative Garibay, Senator Wong, and Representative Belinsky, and distinguished members of the Aging Committee. My name is Meg Morelli, and I'm the president of Leading Age Connecticut, a statewide membership association representing not-for-profit provider organizations serving older adults across the continuum. On behalf of Leading Age Connecticut, I'm pleased to submit testimony on several bills that are before you today, and I will speak to House Bill 6773, an act allowing trained nursing aides and assisted living aides to administer medication to nursing home and assisted living residents. I want to begin by thanking the committee for raising the bill and inviting a dialogue on the concept of expanding the use of medtechs into these two settings. We believe that this would be a great benefit and opportunity for the aging services sector, both for those they serve and for those who work within it, and we thank you for considering it. Currently, Connecticut has an established medication administration certification program that trains and certifies non-licensed personnel to safely administer medications to individuals who receive services through programs under DCF, DDS, and DPH. This bill proposes to expand this existing program to train and certify individuals who are already CNAs or assisted living aides to administer certain medications to residents in the nursing home and assisted living settings. Connecticut would be joining approximately 38 other states that allow this practice in the nursing home setting alone, and many states have done so for years. This certification would provide a career ladder and a pathway to advance roles in the growing field of aging services for CNAs who have a desire to advance their clinical careers. The need for a strong workforce throughout the aging services field intensifies every day as our state's population grows older. Bringing an opportunity for career advancement would be a positive step towards retraining and attracting an aging services workforce. In the assisted living setting, the use of medtechs would benefit the consumer, and particularly those who need to obtain off-hour medication administration assistance. Many assisted living clients self-administer their own routine medications, and some receive a medication reminder from staff. Unlike the nursing home, assisted living residents must be considered chronic and stable. But even still, there are clients who require actual medication administration assistance, and right now that must come from a licensed nurse. This may arise when a memory issue begins to interfere with their ability to identify their routine medications, and therefore, under state regulation, they are required to have a nurse administer them. While an aide can be the hands of the client and open the pill bottle or blister pack, they cannot be the head of the client, meaning that the client must know and understand what medication they are taking, even if it's a pour or a pre-poured or blister pack. The need to arrange for administration from a nurse can be an additional cost for the consumer when it may be very safe and effective, as well as more affordable for the consumer to have a trained med tech assist them. In the nursing home, the opportunity to use med techs would enhance the quality of life for the resident, offer career advancement to the CNA, and provide more time to the licensed nurses to conduct other nursing functions and attend to clinical needs of nursing home residents. The proposed statute would be permissive and not mandatory. No nurse would be required to delegate their authority or supervise a medication technician. The intent is not for the med tech to take the place of a licensed nurse in the nursing home, nor to use it to satisfy the nursing home licensed nursing minimum staffing requirements. In conclusion, we respectfully request that the committee look to the other states' positive experiences and advance this opportunity to allow for certified medication administration technicians to work in the assisted living and nursing home settings. And we would appreciate the opportunity to work together on the language of the bill and to develop a certification process that meets the needs and concerns of the legislature, the state agencies, and the sector. Thank you for this opportunity to testify, and I'd be happy to answer any questions.
Thank you, Mag, so much for that testimony. I'm going to start with one question before I open it. One of the concerns is that it's going to take away from the assigned time that a nurse has to give it away. So if a nurse is supposed to, and I'm just throwing 2 hours, that the nursing homes or assisted living will reduce that time on the nurse, and it'll affect their jobs. How do you see that?
We don't look at it as like replacing the nurse. I think the nurses are really, in the nursing home, there's a lot to be done by the nurse and by the licensed nurse. There are a lot of tasks like nursing assessments, wound care, bandages, ostomies care. And so we believe that if the routine medication med pass was to be able to be done by a med tech who is really concentrating on that, that would give the nurse actually more time to do assessments, to engage with the patients and the residents. It you know, we look at it as sort of a team approach, not a replacement, and it's certainly the goal is certainly not to take the nurse away from the resident. It's really to give the nurse more time to do more of the assessment work and true nursing and clinical work that's needed.
And so it also allows for the nurse to have that, the ability to say, no, I'm going to be working with Mr. Smith and helping him with his meds because it's very critical. It's up to the nurse to either allow or not allow a CNA, right?
Absolutely. Absolutely. This is a delegated authority from the nurse, and the nurse would have the authority to say whether or not med tech would be able to provide the medications to the resident. And it may not be all the medications, but there are a lot of very routine medications that are provided through the nursing home and that are now required to be done by the nurse, including things like applying lotions, things like that. Some of the things that Mairead had raised.
Right. Most of them were non-prescription except for the insulin for diabetes.
Right. And we understand, and we've actually, through some discussions, we understand that's where a lot of the consumers are asking for assistance in the assisted living arena, is with the insulin.
Okay, thank you. Opening to questions. Is there anyone with a question? Seeing none, thank you so much for coming and testifying today.
Thank you. And thank you for raising the bill. We appreciate it.
Okay, moving on. Molly Gardarowski. Hi, Molly.
Hi, can you hear me?
Yes, we can.
Hi, good afternoon, everyone. Co-Chair Senator Hockadell and Representative Garibay, Vice Chair Senator Miller and Representative Fortier, and Ranking Members Senator Huang and Representative Belinsky. My name is Molly Gadarowski, and I'm presenting testimony in support of SB 1176, an act concerning funding for the Office of Long-Term Care Ombudsman and Area Agencies on Aging Service Navigators. I work at the Agency on Aging of South Central Connecticut and have over 20 years experience working with and providing services to older adults, and I work closely with our agency's service navigators. I also frequently get the opportunity to work directly with the clients we serve, to connect them to these services. Service navigation is critical because older adults and their caregivers are often overwhelmed and confused when trying to navigate our health and social care system. They often reach out for assistance during a crisis, and they don't know what they or their loved ones are eligible for or where to start. Service navigators provide person-centered assistance, reviewing eligibility for programs and services. Service navigators assist with the complex and often overwhelming application and enrollment process. Having access to different state computer and enrollment systems allows them to work across all programs to successfully connect people to services. Service navigators have the flexibility to work with clients either over the phone or at their clinic or doctor's office or in their homes. Service navigators are Choices certified to provide accurate and unbiased benefits counseling on all parts of Medicare, and the service navigators remain in place, providing ongoing support until services are successfully started. Yesterday, I was talking with a daughter who was looking for care for her mom. Her mom was recently diagnosed with dementia and lives alone. Her daughter works full-time and has a family of her own, but is spending every evening at her mother's house. The daughter is missing work, exhausted, and burnt out from the emotional and physical tolls of caregiving. The daughter reported that she tried to do her own research to figure out what services her mom might be able to get, but she quickly became confused and overwhelmed. The service navigator determined that her mom would be eligible for the Connecticut Home Care Program for Elders, and they started the application process. The service navigator arranged for the start of Meals on Wheels and assistance with transportation to medical appointments. The service navigator also connected the daughter and her mom to a volunteer who will be able to visit with her mom and provide both socialization and supervision while giving the daughter some respite. The service navigator was also able to connect the daughter to our caregiver support group. Without service navigation, older adults and caregivers will go without services and support, putting them at risk, adding to the emotional, physical, and financial toll that can lead to poor health outcomes for older adults and increased caregiver stress. Thank you for your time today and for considering the importance of this critical service, which allows us to reach thousands of people each year who would otherwise be at risk.
Thank you so much, Paul, for your testimony. Are there any questions? Rep. Fortier?
Just a comment, Chair Garabay. I don't know how much you've been involved with the Aging Committee, but I want to tell you that there's at least 4 or 5 of us who have been in that position of that woman that came to you. All of us have cared for our aging parents, and some of us have what we consider to be decent skills in terms of navigating all of our state systems, and it is not easy. So we appreciate you and are grateful to the work you do. Thanks.
Thank you. Thank you very much.
Thank you so much. Is there anyone else? Thank you so much for your heartfelt testimony. We really appreciate it. And
Thank you, everyone.
And I'll hand the meeting back over to Senator Hockadell.
Thank you so much. Next, we have Jean Mills Aranha.
Thank you. Can you hear me?
Yes, we can. Go ahead, please.
Thank you. My name is Jean Mills Arana, and I'm an elder law attorney with Connecticut Legal Services. I serve on the Governor's Nursing Home and Assisted Living Oversight Work Group, and I currently serve on the advisory board of the Southwest Area Agency on Aging. Speaking on behalf of Connecticut's legal aid programs and our low-income elderly clients, and I'm in support of 2 bills, HB 6775 and Senate Bill 1176. On 6775, my colleagues and I have come before you several times in the last 15 years to discuss the personal needs allowance. I won't go through each change, but in 2011, the P&A was reduced and its cost of living adjustment was eliminated. It's since raised to $75, but the cost of living adjustment was not restored. As you all know, the cost of basic items and services keep going up. Nursing home residents are in a special situation, having lost much of their freedom to travel, communicate with family and friends, and buy things they enjoy. The P&A must cover things that most of us take for granted and are easily able to purchase, such as clothing, shoes, haircuts, cosmetics, books or magazines, vitamins, knitting needles and yarn, postage, cell phone and computer service, and cards or small gifts for family. Obviously, $75 is not enough to cover all the things that might enhance the quality of life for the resident. Several other states have higher P&As, and federal law allows the state to set the P&A as high as $200. While 6775 does not increase the P&A, happily it will reestablish a cost of living adjustment that will allow it to increase each year. This will help nursing home residents to live with dignity, maintain relationships with family and friends, and pay for some basic needs. We strongly support the passage of this bill. We also support Senate Bill 1176. Section 1 is increased funding for additional long-term care ombudsman. You heard from Mairead, who does a wonderful job, so I won't repeat all the services provided and the great need. But the number of calls and complaints that the ombudsman is receiving has increased dramatically in recent years, due in part to inadequate staffing in facilities. The ombudsmen are stretched thin, as you heard, which can only lead to longer wait times for residents' concerns and complaints to be addressed. And so we're in favor of this appropriation. We're also in favor of increased funding for service navigators throughout the area on aging. Again, you've just heard from some of the actual navigators. So some of my I'll leave some of my written testimony to you to read. But I will point out, as we all know, locating and successfully applying for the many benefits and programs available to this population is complicated and a daunting process, particularly for those with hearing, vision, and technology barriers. I can tell you that even as attorneys, we have a hard time keeping up with how to apply for every benefit that our clients are eligible for. Without the assistance of the service navigator, individuals are at increased risk of nursing home placement when they cannot identify and access the services and benefits they need to stay home. Most importantly, almost everyone would prefer to stay at home. And furthermore, the cost to the state is obviously much less if nursing home admissions are reserved for those who absolutely need that level of care. The service navigators save money while supporting the independence of the consumers and their family. We urge you to add this additional appropriation to provide 4 dedicated service navigators in each area of agency, making these valuable and cost-saving services available to every city and town. Thank you for the opportunity to testify before you and for your ongoing concern and action to improve the rights and care of the elderly residents of Connecticut, including those in long-term care facilities.
Thank you so much for your testimony. Does anyone have any questions for Jean? Seeing none, thank you again and have a great day.
Thank you.
Thank you. Next, we have Natalie Shortleff. I apologize.
Hi.
What was your name?
Hi, this is, can you hear me?
Yes, we can. Go ahead.
Hi, this is Nora Duncan. Actually, Natalie Shortleff works for me, but has had some snow and related issues. So I am jumping in her place. So I'm the state director at AARP Connecticut. And I first want to apologize that you don't have our written testimony. I am still waiting for a little analysis on something before I submit that to you. So you'll have that completed in the record soon. So I appreciate you guys having me here and thank you for allowing me to step in for Natalie. I wanted to just give a few words. I don't think I need to elaborate a lot because the people who have gone before me have been very eloquent in explaining some of the things that we're supporting. But in Bill 6775 regarding the personal needs allowance, we do agree that that should be higher, comparatively to other states. We're low, $75 does not go as far as it did even a year ago. So we definitely support that and, helping residents of nursing homes be residents of their homes. I'm trying to figure out how I would manage on $75 for a personal needs allowance a month in my home, and it just wouldn't work. In Senate Bill 1176, the funding for the long-term care ombudsman and the area agency on aging service navigators, I cannot tell you how many people AARP refers to the navigators due to the complexities of the issues that are faced by individuals and caregivers that you've heard so much about. I've been doing this job for 13 years. I know so little about the details that we must refer people to the navigators. And in terms of the long-term care ombudsman, in particular, with the growing number of people receiving care at home and that now the long-term care ombudsman has that under her purview as well, it's really critical that while the state obviously faces budget restraints and this committee is not a budget committee, we hope that funding services and programs that help prioritize keeping people as they age in their homes will be, part of what you can bring to the rest of the General Assembly when talking about the budget. And then House Bill 6772 and Senate Bill 1177. Generally not a fan of study bills, as probably a lot of people aren't, but like the rest of the nation, we are on the verge of an unprecedented demographic change. And by 9 years from now, we'll have more people over the age of 65 than under the age of 18 for the first time in US history. So, declining birth rates is really what's driving this demographic, as well as people living longer. And that's, we want people to live longer, but we also just really haven't kept up with that demographic change. So, we do want informed policies and policymakers. So if this is a way to get folks to help better understand the needs of a changing population, then we support and would be happy to participate and provide any kinds of backup information that you might need in order to accomplish the goal at hand. So with that, I will just wrap up.
Thank you so much, Nora. We have a couple of questions. The first is going to be Rep. Hughes, and then we have Rep. Garibay.
Thank you, Nora. Thank you for all the work that your organization does. I'm a little curious, when you say you are referring, they're calling AARP, you're referring folks to navigators. Does that include, we've seen a huge rise in the Medicare Advantage plans, which honestly are more costly to the state and to often the consumer if there are, a narrower, restriction of actual benefits or denial of claims. And I'm wondering if the navigators end up seeing the fallout of that, or AARP does, because, as we make the case, obviously, for increasing the number of navigators serving our increasing population, I want to show Appropriations Committee, if you will, how we can save some money on making some smart decisions on those, on those choices on the upside, I guess,
So-
especially of the downstream costs.
Yeah, so this is what I don't necessarily refer plan questions to navigators, but I always refer anyone who asks me or asks AARP about what they should do when choosing a Medicare option is refer them to the Choices program. That's the only answer we ever give. So there was a question about, a specific plan in the middle of the plan season, and obviously people roll into plans as they turn 65. This is definitely a question we send there because they're the experts. They have the, they're not plan, they're not carriers, they're not anything, right? So except for people who are good information through the tax dollars that are coming in that you've already paid. So we send folks to the Choices program, and the Choices program is run similarly along, through the same organizations as the navigators. And in terms of what they do in terms of collecting data, I do not know. If we get questions regarding somebody having a rejection or a problem with a plan, I send them off to my friend Judy Stein over at the Center for Medicare Advocacy.
As do we all.
I'm looking at a sign that says, "Thank you, Judy," from an area from the last conference that Aging CT had. And I'm like, what is the name of her organization? Center for Medicare Advocacy.
Yes.
Or we send them to the Office of the Healthcare Advocate also.
Right.
Yeah. So, we act as a referral constantly because they don't know where to go, right? And all these kind of questions that you guys have, all the things that have been spoken about today, we're not a direct service organization. We're education, outreach, advocacy, but people know who we are, so they come to us. And because we lack the expertise, we need to send them to the people that have the expertise.
Your organization is so important with that, Nora, and that's why I want to lift it up, because we are seeing an onslaught of advertising dollars spent by these big corporations on every platform, on radio, on TV, on cable, on social media, in the mail, saying all these benefits that, and how do we combat that when it's actually costing, like I say, it's costing the state, and then we end up paying the difference for these services that are, basically shortchanging and our seniors. And so that's why AARP's voice in this, in this patchwork is so important. And, we as the state government want to help spread the word on good services, on eligible services, but also, not on cost savings, and that's where I think the navigator can help in this, outreach effort. So I'm just lifting that up as another thing that
Yeah.
we're
I'm
paying
sorry,
for
my
in the
doorbell is
seniors.
ringing and there's a big speaker in my office when that happens. So, and there's no one here to answer it, except me. So sorry about that background noise. Yeah, I mean, Representative, we talk about this too when it comes to the advertising dollars that prescription drug companies use, et cetera, right? So, I don't know what the answer to all those questions are and what the free market bears, but yeah, there's a lot out there, and I'll just go back to the fact that this is why the Choices Program, the navigators, the ombudsman, Medicare, Center for Medicare Advocacy, and the healthcare advocates are so important in what they do in helping people with individual cases.
Thank you. Representative Garibay, floor is yours.
Thank you, Nora, for coming today and for all your advocacy that you do and your team at AARP. I agree with everything you said, and I just wanted to say that not only do we want people to live longer, but they want them to have a better quality of life during the years that they're here on this planet, and that we're not just warehousing them until they die. So I appreciate your advocacy on this. And again, thank you.
Yeah, and I was listening to the long-term care ombudsman testify, and I appreciate you talking about warehousing people. And she was talking a little bit about smaller homes, and I would encourage the aging committee to take a look at something called the Greenhouse Project. It's a different way to have skilled nursing, smaller settings, more home-like settings. And it's a project that does not exist in Connecticut, but does exist in some neighboring states. But the Greenhouse Project is of interest. And again, Representative Garibay, and I know there's all of you know this, but this is the aging in place is what people want to do. And I don't want to make a mistake that place means the exact same place you've been living for 50 years. It can be the setting of your choosing, and we want to empower people to choose how they live as they age. People really don't choose to live in nursing homes, but they might choose to live in smaller home-like facilities that can take care of them. And there's some beautiful examples. I think the aging committee members, a lot of us went to one in Bloomfield, but those went to the bill signing from last year, from the amazing bill you passed, but those are really expensive places to live. So trying to figure out a way to create environments and opportunities. It's not necessarily what the bill's about today, but yes, I agree. And I thank you all for focusing on it so much.
Well, it's providing people that they still have choice, right, where they age. And I'm for all the avenues because I've known a constituent who lives in a local nursing home and she loves her nursing home.
Yeah.
So that can happen too. We want all the areas available and let people choose where they want to be. So thank you. Thank you, Madam
And have
Chair.
quality of choice, right? Not just quantity, but also quality.
Yeah, we want happy seniors,
Yes.
And they deserve it very much. Thank you, Norris. I see no further questions. So thank you for your testimony and have a great day.
You too. Thank you.
Thank you. Next, we have Kim Sander from the Connecticut Nurses Association. Kim.
Good afternoon, everybody. Senator Hockadell, Representative Garibay, Senator Miller, Representative Fortier, Senator Wong, Representative Belinsky, and all the members of Aging Committee. I really appreciate the opportunity to provide testimony today in opposition to House Bill 6773, an act allowing trained nurses, aides, and assisted living aides to administer medication to nursing home and assisted living residents. We have submitted our testimony. It's probably not posted yet. Sorry for doing that a little bit late, but I did include some links and references in there that you may find interesting as a follow-up to today's testimony. I really appreciate everything that you do on behalf of seniors. Listening to the testimony today, it just really elevates all the rock stars it takes to come together and do the work in caring for our seniors. My name is Kim Sandor. I'm the Executive Director of the Connecticut Nurses Association, and we work to represent the nurses in Connecticut across all specialty areas and practice settings. We celebrate and recognize a diverse healthcare workforce that ensures patients in Connecticut across all specialty areas and practice settings receive safe, competent, and quality care. The workforce has varying knowledge, skills, and educational backgrounds, but everyone holds a piece of patient care that aligns with the competencies, and we acknowledge the importance of that incredible team. Mag Morelli did just share with you, that there are multiple agencies that do allow for unlicensed assisted personnel to administer medication. But I just want to really highlight the differences that are in the long-term care landscape and our concerns in that space. Patient safety is always our top priority. I refer you to Edie Ouellette's testimony that was submitted. She is a nursing educator and knows all about that goes into nursing education that goes well beyond just giving someone a pill, but really understanding the medication conditions, side effects, etc. It's very complex and complicated, and I think that you will find that interesting. And I elevate that because when we're talking about the elderly, we have to consider the vulnerable population they are and the complexity they present. They usually have multiple chronic conditions, and this aligns with polypharmacy, which means lots of different medications multiple times a day. My two parents just moved in with me, and they have a whole cabinet devoted to their medications. So it's a lot, and it's a lot to go over. And that with the conflating problems of cognition issues, fine motor ability, difficulty swallowing, etc., really makes it a little bit more complicated. The National Council of State Boards of Nursing, I think, really hit on the issue of medication administration and delegation well, because it highlights the three areas that need to be strongly in place in order to do this successfully. One is organizational readiness. The organization has to provide policies, practices, training, ongoing monitoring, communication, etc., that fully supports this going on. You need a trained staff that is consistent, that is reliable, and has been working together, that knows each other's strengths and challenges, and can really work with a community that they know so well. In long-term care, we know LPNs are generally the medication administrators, and there are more LPNs than there are RNs usually in a long-term care facility. We also know over the years they are more heavily reliant on agency nurses. This fragments and complicates those two buckets of, well, all three really, organizational ability to understand the policies and processes that are meant as redundant system and safety checks, as well as you have staff that may not be used to the patients or working with each other being asked to delegate certain things. And delegation is a huge thing in nursing. I did put a link in my testimony to try and further explain the responsibility, but it actually requires, in this bill too, requires the RN to do the delegation. So that means the RN has to
Your
have
3 minutes are up. Please summarize.
Thank you. The RN has to have an understanding of the patient, their current status, be able to delegate, be able to know that the person they're delegating to is able to do the delegation, and then also follow up and monitor it. So if a nurse actually refuses to delegate, who's going to step in to do that work, and are you staffed as a way that allows to happen? So again, sorry to be over time. I did include some more in my testimony that is getting submitted and should be available to you later in the day. And as always, we are happy to chat and work with you to address some of the issues that you're seeing.
Thank you, Kim. It's always a pleasure to speak with you. Can you tell me how you would feel about possible non-prescription folks that would be able to give the non-prescriptions like the Tylenol, the suppositories, and things like that Mairead had mentioned?
Yeah, again, I think it goes to it just goes to process, like how are you actually going to get this done in a safe way? One of the pieces that works so well in states that do this is thinking about who's doing the delegation and what else do they have ownership of? One of the states is the director of nursing that actually delegates. So talk about someone, in charge of that organizational culture, that the first speaker really spoke well about, is that some places are just their happy staff and their staff that are staying, and that they might be very well-oiled machine that may be able to do things differently than someone who's heavily reliant on agency staff. So, I think there's so many factors. And when I went into Medicare.gov and looked at the ratings of the nursing homes, they had 196 or so that were rated. And when you put in staffing and quality together, that had a 4 or 5. I wasn't just going for the 5-star, but a 4 or a 5 rating. There was only 36. So I'm kind of just stuck in a space of readiness, to be able to do something like this. I saw in 2006 there was a bill that proposed a pilot. I don't think it ever happened, but where are we really for this? There's so many more patients and they're such a vulnerable population.
Great, thank you. You have a question from Representative Garibay?
Sure.
Rep. Garibay, you're on mute, huh?
Thank you, sorry. Thank you for coming and testifying. One of the questions I have is that DPH, the Ombudsman's Office, and others that receive complaints that many times it's because the insulin or the diabetes medicine was not given in a appropriate time, so their blood sugars went out of control, etc. So if a med tech, a trained CNA, could give out over-the-counter and possibly diabetes, because some are going 6 hours without that medicine in the morning, they're given food, they eat their breakfast, etc. You don't see any place there for CNAs to be helpful with that.
Oh, it's not that I don't. I mean, we know that Connecticut is not new to thinking about unlicensed assisted personnel doing medication administration. I've worked in the early childhood space, which actually doesn't do medication administration as delegation. It's actually just a professional activity. It's not actually delegated by a nurse. So, I don't not understand, what's being trying to be achieved. I think diabetes medications and injections are actually one thing that I would not put in the hands of unlicensed staff. I think the interplay of that is a little bit more complex, and I would be more towards doing something that wasn't going to have such a dramatic impact if it was done, if something was, amiss. You have a wrong dose of insulin and someone goes into, a diabetic coma for hypoglycemia. It's not something that that's not probably a direction I would go, but I just think we need to know more and think more about it than just coming at it this way. And quite honestly, I got notice of the bill and started looking, and we don't have a massive team. I couldn't do as much research and pulling together information as I wanted, but I started to collect and look at what was being done in other states and began connecting with nurses in those states to understand, what are the challenges and successes that are working there, so that we can hopefully be a participatory partner, in the future, trying to figure some of these things out. But, I understand we have an immediate need, but I worry about the readiness, and if we can't do one without the other. Like, I think that the ultimate safety of it, we need to be able to, have a stable workforce, have really good organizational pieces, be able to have, nurses aides that want to do this work, that actually, want to do it and want to be able to participate in it. I think it's a great pipeline issue, quite honestly, for the workforce. And if you could get RN students and LPN students, they, would be so into this. And it's part of those workforce conversation is to think about those pathways. But I haven't done fully thinking on it, as I was just presented with the bill recently.
Right. So that's one reason why we have a hearing, so that we can bring many voices to the table and hear the differing of opinions. We've been doing the same research that you've been doing. And just to correct, it is not going to take away from the allotted time that the nurse has and reduce what a nurse does. And I would also hope, like you say, but I don't see it happening. It could be happening, but I don't see it happen a lot where the RN, the LPN, and the CNAs are actually working together. They each have those separate jobs, so that's something I would like to work on too. But I appreciate your opinion and we'll take it very much into consideration. Thank you.
Thank you.
Thank you. Kim, you also have a question from Representative Belinsky.
Sure.
Yeah, I'd like to, I'd just like to say thank you also for the input. But also, you know, just bring us all back to the fact that what we're trying to do is relieve some of the staffing pressures that are on, you know, our nurses. And I think that the discussion about the non-prescription initialization of a program such as this would be a pretty suitable compromise. And you know, just between myself and the committee, you know, I administered medications to 3 separate parent and in-law folks for about 10 years. It does not require rocket science if you have good direction. And as far as diabetes care goes, you know, I'm going to put my my 2 cents in is that treating somebody with the insulin dependency is far easier today than it was 10 years ago, because, you know, while I was pricking fingers 4 times a day and then trying to fill a syringe with, you know, with the appropriate medication, which, by the way, we survived that. Today, myself as an insulin-dependent diabetic, I have a continuous glucose monitoring system that is also transmitting my blood sugars and my current status to my endocrinologist, just as if that same system could, you know, send it to a nursing station if somebody does have a, you know, a hypo or hyperglycemic event. And then the administration of the insulin is now handled in a pen. It's literally something that is on a level where there's not a serious decision to be made, life or death, like the eventuality that you discussed a moment ago. Perhaps, you know, a diabetic, a coma is coming on or something like that. In 99.99% of the cases, this is something that actually doesn't require a half an hour of the nurse's time, and can be administered by, you know, by a CNA, even by a family member. So I just want to do what's best for our patients and for our loved ones, and all the guidance that we can get from the Nurses Association is critical and appreciated. So, you know, thank you very much, and hopefully we'll work together on this.
Thank you. Thank you for those comments. And I really appreciate you speaking about what you've done at home and, you know, how comfortable you felt doing it and how well cared for you feel at the moment. But I do want to highlight how different that is than, you know, you have your 3 parents, you know what they're on, you know how they are, you know how they act, versus coming into a floor and there's 30 patients and how many CNAs are caring for how many patients. And it's a regulated system. So there are expectations around best practices and documentation and things like that that further complicate communication versus you going to an appointment with your parents or know that they went, and then you're hearing the follow-up and you're checking the medicine to make sure it was changed and stuff. Those happen on a systematic level in a facility. So it's such a different lens that, yes, the task, the task of the administration can be taught, but it's how do you operationalize that on a large scale to ensure safety so that things are communicated. And there's things such as like maybe the patient threw up that morning and doesn't have an appetite, but they still got their insulin shot. You don't, I mean, things happen, but the question is, how are those things communicated? And then how are decisions made about what to do and what not to do so that the follow-up is there? And believe you me, my nurses would love me more, every day if I made their lives easier. And that's the importance of having the staff. And I know the concept of team is there, but it really is, especially when it comes to delegation, because the RN is still responsible for assessing what they're delegating and making sure that person can do it, making sure the patient is ready to receive that from the person, and then following up to make sure it's being done. So as much as they might not have to go in there and do it, they're still doing 4 and 5 things around it to fulfill the requirement of delegation, which comes from being a licensed professional working in a regulated system. So it is different. And I think the number and scales are different. And, I think that's a hard thing to appreciate if you're not in that space looking and thinking about some of those systems, because we all have done it at home, whether it's for a child, an aunt, an uncle, or our own parents. So I really appreciate you bringing that up and allowing to try and clarify some of that distinction.
Yeah, well, just for your information, I do understand the other space because 2 of the 3 of the individuals that we cared for in my family wound up in skilled nursing facilities, and I completely, totally understand the difference between individual family care and the frustrations of competing for care in a long-term care facility setting. Again, I will, just ask your indulgence in helping us plan a way to take some of the heat off of the nurses until the workforce development occurs and we have a balanced way of caring for everybody in every circumstance. It's the processes, the oversight, the disciplines, and the chain of authority is something that we most need your help with. So I look forward to working with you. Thank you.
Thank you.
As always, Kim, thank you for your testimony, your insights, and working with us. I don't see any more questions, so have a great day.
Thank you, you too.
Next up, we have Christy Covell from the Connecticut chapter of the Alzheimer's Association.
Good afternoon. You can hear, yes?
Yes, we can hear you, Christy.
Wonderful. Thank you. Good afternoon, Senator Hockadell, Representative Garibay, Senator Wong, Representative Belinsky, Senator Miller, Representative Fortier. My name is Christy Koval. I am the Director of Public Policy for the Alzheimer's Association Connecticut chapter. It's a pleasure to be here today. And for those that may not know, the Alzheimer's Association leads the way to end Alzheimer's and all other dementia by accelerating global research, driving risk reduction and early detection, and maximizing care and support. I'm here today to comment on Raised Bill 1176, an act concerning funding for the Office of Long-Term Care Ombudsman and Area Agencies on Aging Service Navigators. The association is pleased to support this bill. You do have my written testimony, and I just want to call out a couple of things to highlight our support in this. We issue a report every year for Alzheimer's disease facts and figures, which basically talks about prevalence and the state of Alzheimer's in the country and also in the state. And each year we issue a special report. And last year we issued a report on mapping a better future for dementia care navigation. And I highlighted that in the written testimony because, as we know, as we are aging, we are an aging state, we are an aging nation. And as the complexity of medical treatments and patient care systems has increased, the concept of patient care or service navigation is growing. We have a number of individuals who will call our 24-hour helpline, and they are calling in a time of high need. And we often times refer to the area agencies on aging for that touch point, the providing of resources, and accessing programs and services. So what we do know about service navigators are they are really that person-centered point of contact who can help people who have really, they may not have families living close by. They can really be that critical piece of assistance. And also, just as we know, navigating the system for long-term services and supports has a number of different challenges. So particularly if someone has Alzheimer's or another form of dementia. Additionally, I want to touch upon the value of the Ombudsman program. We know that there are a high number of individuals with Alzheimer's or dementia who live in skilled nursing facilities. We do know that the Ombudsman plays a critical role in not only just investigating complaints, but also making sure that the quality of care is what it needs to be. And we know that this is a challenging role and they do an amazing job. So we do know that more resources could be allocated in this area, particularly for our folks in the skilled nursing facilities. I'm happy to answer any questions regarding either of these two areas. It is a pleasure to be here today.
Thank you, Christy. Always a pleasure to speak with you. Mitch, Representative Belinsky, do you have a question?
I'm sorry, Madam Chair, my hand was still up. I apologize for that, but I will chime in and say thank you very much for all that you do. Christy, you and your organization are very, very, very good partners to us, and I appreciate that.
Thank you very much.
I don't see any other questions, so thank you again, Christy, and have a great day.
Thank you. You too.
Okay. Next, we have Marie Allen.
Good afternoon, Senator Hockadale and Representative Garibay, esteemed members of the Aging Committee. I am speaking today on behalf of the Connecticut Agencies on Aging, and we are in support of Senate Bill 1176. You know, 88% of older adults hope to remain in their homes and stay in their communities through the end of their lives. And if we're lucky enough to live to be 65 years of age, 7 out of 10 females and 6 out of 10 males will need long-term care services and supports. A lot of people rely on Google and other search engines, which present advertisements for long-term care. To Rep. Hughes' point, a lot of information about Medicare Advantage, some of it true, some of it not true. And when they're searching, there's no consideration to the cost, the quality, or the eligibility in the information presented. The landscape for aging services becomes so confusing that quite often families feel that a nursing home is the only viable solution. But when we look at individuals who have saved all their lives and have some assets, let's say $100,000, when they go into a nursing home, they're going to pay a rate of about $505 a day. So in 198 days, they've depleted all their savings, and those individuals flip payment sources over to Medicaid, which is 50% paid by our state and 50% by the federal government. It is so much more cost effective and so much more humane to look at community-based services. Community-based services cost approximately 1/3 of institutional or nursing home placement. And service navigators are that critical element. They're really part of a burgeoning system related to changing the way we provide services to older adults and persons with disabilities. The agencies on aging have been at the forefront in breaking down the barriers between state and federal systems that have long-term been siloed by providing information from the client's perspective, not a bunch of jargon with acronyms that no one understands. We support the community, and I know you've heard so much about those individual stories. I just want to talk for a second about the system. The community is where people go to get their services. They may walk in through a senior center, human services department in a local town, municipal agent, but when they're stuck, they come to the agencies on aging, and there's a lot of written testimony for you to review that speaks to this from the point of view of the community, municipal agents, and senior center directors. It's almost like a building where people come in on the first floor, they go to their local town, they get the information they can. But when they're stuck in this system, when there's a problem with Social Security, with Medicaid, when they cannot figure out how to make things happen for the individual, they come into the Agency on Aging. We use a triage system with information support specialists at the beginning, and then we move them through to respite specialists, caregiver specialists.
Your 3 minutes are up. Please summarize.
Thank you. And then to our service navigators. So we look forward to your support. We thank you for the support you've already given us.
Thank you so much for your testimony. You have a question from Senator Wang?
Thank you, Madam Chair. Welcome, Marie. Thank you for the great work that you all do in all of your area agency on aging, perform in liaison with our senior centers and social workers. Talk to me about this request and how it fits into the great work that was done by this committee last year, that we did put in navigators. And do you have anecdotal fact of impact, meaning that the results and the contact points and the facilitation that has really greatly improved in providing services to kind of justify the additional staffing that we're talking about here? And out of the 5 area agency on aging throughout the state, are you looking to add one more to the current allocation in regards to numbers? Because obviously there's great support of this, but there's going to be a fiscal note. So could you elaborate in regards, one, the anecdotal facts and success of liaison of success, and number 2, are we looking to add one more to each of the 5 for a total of 5? Because that's important for us to calculate the fiscal note and impact.
Thank you so much for the question, Senator Wang. First of all, on impact, every person who we are able to divert away from a nursing facility by getting them settled in their home with home and community-based services is going to cost about 1/3 to the state as it would if they went into a nursing facility. By prolonging people in the community, allowing them to stay where they want to be, and getting them those wraparound home care services, home delivered meals, working with our Visiting Nurse Association, working through the Connecticut Home Care Program to provide homemaking, companionship, medication management, all of those things, we are able to save this state countless dollars. It's very hard. We've always had this problem of how do you prove an avoided cost? But we know that individuals who come on to the home care programs who get respite services are at nursing home level of care. That means they need assistance with bathing, with dressing, with eating, with medication management, with transferring. Those things put people into a nursing home. So every person that we can help navigate, these are people who have tried to apply for Medicaid, Title 19, 3, 4, 5 times, and they get so stuck in the process. They don't understand what's being asked of them in the paperwork that comes back to them. There's a divorce decree somewhere in Puerto Rico that they have to find and provide as proof of divorce. These are the things that the navigator helps with. And right now our navigators are taking about 25 calls a day. So not all of 25 people would be headed towards a nursing home, but some percentage of them are, and those are the people that we're helping. So right now, each area agency on aging, there are 5 of us across the state. We're all federally mandated. That's an important designation because it brings with it federal funds. So we are blending and braiding together all different funds that support the individual. A lot of our home delivered meals are paid for with federal dollars. A lot of our respite care is paid for with federal dollars. That's what makes it effective. So when people come in, we have 2 navigators at each of the 5 area agencies on aging, 10 right now throughout the state. However, one of them was paid for with ARPA funds, and those funds will be sundowning at the end of 2025. And our concern is there is no way. We have built it thanks to, I have to say thank you to Rep. Garibay for helping spread the word about these navigators. We've built it and now they're coming. And they are coming at rates of 25 calls per day. And my biggest fear is if we have to let go of one and we're not replacing them, then we are not going to have the staffing to help. And the community has come to count on us. We just had some legislative breakfasts where the community talks about the importance of having that capacity building aspect. We are asking, we have one in the state budget. We have one other that will sundown at the end of this year. We are actually asking for an additional 3. One could be postponed until next fiscal year, but we do need 3 more so that we have 4 per region. 4 times the 5 regions is 20 statewide. The fiscal note for that is about, for all of the service navigators together, is $2 million.
Thank you very much for that clarification. You've set the task. I think what you just talked about, if you could share, as we want to support and advocate for this, is talk about the increased call volume. And I think another example that the difficulty has been, how do you quantify savings that is not incurred? But I guess the best way I could put it was listening to the example from the previous testimony about our nursing staffing issues, is as represented by Representative Belinsky, that at home care with loved ones, you know who they are, you know what their unique needs are, you're given a higher attention and care that cannot be substituted. So that is one great example of aging in place. And I think the second part is the big unknown is, I guess if I could, if our federal budget as a federal center of funding is altered, what recourse do you have for the critical services that you provide right now that is paid for by federal funds?
Very little recourse. We are funded through the Older Americans Act. The Older Americans Act was reauthorized last year. In today's political climate, anything is possible. And each of the 5 area agencies on aging are having those active discussions with our board. Many of us have done our very best to diversify our funding bases so that the critical services remain paid. But there is no doubt in my mind that should Older Americans Act grant funding be decreased, the services of the Area Agency on Aging will be decreased. And most importantly, critical pieces like Meals on Wheels, like respite services for caregivers who are totally overwhelmed and unable to care for their loved ones, those items will be affected. Our state has certainly made a commitment in many wonderful ways to older adults, but it is a partnership with those federal dollars, so it would be many difficult years.
Well, please keep in touch and keep us updated. I know personally the great work that you and our various senior centers do. So, but if any of these policy concerns or any funding shortfall that you see from the federal government, please obviously alert us as a committee of cognizance in providing the forefront of legislative advocacy for seniors. So thank you very much, Marie, and thank all of your volunteers and board members for their tireless work as well. Thank you, Madam Chair.
Thank you.
You have a question from Representative Hughes?
Thank you, Madam Chair. Thank you, Marie. Again, I'm wondering if you have any. It really sounds like our navigators are emerging as the frontline defenses against catastrophic, crisis, emergency. So we are wondering if you could forward to the committee chairs so that they could advocate for appropriations. Again, what this looks like in terms of call volume increases and savings on the back end of people just, what I see in my work is when people are not in touch with this patchwork system. They go to the hospital because of a fall or an emergency, and then they go to rehab and nursing home directly because they haven't had the, alternative systems. They don't have a navigator advocating for a eligibility of even Medicaid or other services, in-home services. So by default, they're going into the nursing home. And I'm just wondering how we can quantify the savings by having these navigators work with people before they become hospitalized, because that's the default going into the nursing homes. Really, ultimately, that costs the state so much money.
Thank you, Representative Hughes. That's a very wonderful point, and I'm glad you're illuminating it. I believe that many people end up in a nursing facility simply because it is the path of least resistance, right? If someone is sick and in need of help, they go from the hospital right into a nursing home. It is more difficult to put together the care plan. And again, that speaks to the value of a service navigator. It's very difficult. I think it was Senator Hockedal who said that many of you have struggled to help your older loved ones within your families apply for supports or get the services they need. It is not an easy system, and each family comes with its own everyone's a little bit different, and the type of informal supports that one family might have, the next family doesn't have. And that's why you really have to peel back the onion. That's where the service navigators are so successful. Someone comes in and they're having trouble paying their rent. It's not just their rent that they're struggling with. There are many other things that they're struggling with. They're probably not taking their prescription drugs because they don't have the money for it. They're probably not eating healthy, which is only exacerbating their diabetes or their other chronic conditions. So taking that holistic approach is so very important. And the more quickly that we can answer the phone, so that we are doing, same day support for clients rather than making them wait, the more quickly we can answer that phone, the better chance we have of diverting someone away from a premature nursing facility stay. I'm going to give a lot more thought to how we can quantify it. There's got to be some way of looking at the cohort that we help through the area agencies on aging versus, the general population and how quickly people go into nursing facilities. But there is, for every person we're able to support with home care services, that's a person who would have gone into a nursing facility because they are not able to maintain their independence.
Great, thank you. I know that those numbers and the even projected savings on the back end would be helpful to really ensuring that this funding is included and stable and sustainable going forward as our population ages. Thanks.
Thank you.
Any other questions for Marie? I don't see anything. So anyone, so thank you for your testimony and have a great day.
Thank you.
Next, we have Matt Barrett from the Connecticut Association of Healthcare Facilities.
Hi, good afternoon, Senator Hockedal, Representative Garibay, and to the members of the Aging Committee. My name is Matthew Barrett, and I am president of the Connecticut Association of Healthcare Facilities and the Connecticut Center for Assisted Living. And I thank you for this opportunity to testify in support of House Bill 6773, an act allowing trained nurses, aides, and assisted living aides to administer medication in nursing homes and assisted living residents. Our association supports this bill because our members believe that authorizing the administration of medications by certified medication aides can improve quality outcomes while providing an important and badly needed additional recruitment and retention tool in both the nursing home and assisted living settings. A nurse aide with specific medication administration training would offer a critical career ladder opportunity for CNAs in Connecticut. Meanwhile, nursing home LPNs and RNs would be better able to focus their work on more complex resident care responsibilities. This proposed authority is similar to authority currently provided to certified medication technicians serving residential care homes and home health agencies in Connecticut. We recommend the following provisions be added to the legislation to address issues and concerns that have been expressed to our association in the past. First, the language should make clear that delegation by the nurse is authorized and not required under any circumstances. Two, the delegation should not include the administration of medications administered by injection. The certification of medication administration be required specifically in accordance with regulations adopted by the Connecticut Department of Public Health. Next, a registered nurse may not delegate administration of medications in either setting if the prescribing practitioner specifies that the medication shall not only be administered by a licensed nurse. We're reviewing the indemnification language in the provision. We think that's a reasonable provision, but we're not able to comment in a final way on that language. Finally, we offer the following research in support of the bill. The certified medication aid role is well established and widely used nationally, providing decades of experience. 35 states allow skilled nursing facilities to employ medication administration aids, and CMAs reduce the probability that a nursing facility would receive a deficiency for unnecessary drug use or medication errors by 5%, according to the research. The National Council of State Boards of Nursing conducted a study affirming the safety of this delegation in quotes, medication aids are capable of safely administering medications, and there is no evidence that medication aids have a higher error rate than licensed nurses. The medication aid expands the caregiving team, providing immediate relief to overburdened RNs and LPNs, freeing up the amount of time they spend on routine medication administration and resulting in higher nurse and patient satisfaction. A study on the impact of medication aids and use in skilled nursing facilities published by gerontologists found that using medication aids allowed licensed nurses more freedom to engage in more critical nursing care and supervision of CNAs. And with that testimony we've submitted in writing for the record, I'm happy to answer any questions you have, and thank you very much for the opportunity to testify.
Thank you so much for coming and testifying. We appreciate your opinion and also the facts that you brought out. Did I see Rep. Belinsky with a question? No? No. So, yes, he does. Thank you. Rep. Belinsky
Thank you.
and Representative
Madam
Udo.
Chair. Matt, I thank you for presenting the research that I was referring to metaphorically before. I look forward to taking a look at that. I appreciate it. Thanks for your help.
Thank you very much, Representative.
Rep. Zudo.
Thank you, Madam Chair. To Matt, I just had a quick question. Do you typically hire your students that are, say, CNAs from private occupational schools, or are they coming out of medically trained facilities, UConn and so forth, Quinnipiac?
Well, I think they come from all those environments. I guess I don't have good numbers on the extent or the breakdown, but both those environments are part of the hiring pool.
And again, does that impact your liability, your insurance, and so forth? And does that trickle down to the patients ultimately in their costs?
Well, related to this specific legislation, as drafted, this bill would provide a level of indemnity specific to the nurse delegation. I hope that's responsive to your question. Subsection C in the bill actually provides that indemnification provision. We did have a question about whether or not.
Right. I'm sorry. Go ahead, please.
We did have a question about whether or not the indemnification applied to negligence related to acts that may occur during the administration or during the overseeing of the medication. But absent that, we thought the indemnification provision was a reasonable provision. And I think we understand it's borrowed from another section of the Connecticut General Statutes. Again, I don't know if that's responsive to your question, but
It is. I'm just concerned about the additional exposure, that could happen. Listen, humans make mistakes regardless of an RN, LPN, MA, whatever. So I just wonder if all of a sudden that will add another layer of costs. And I think you've covered that, at least with the indemnification. But I thank you for your time.
thank you.
Rep. Belinsky, do you have another question? Your hand is still up. Okay. Okay. Thank you so much. Matt, thank you for your testimony.
Thank you, Representative Garibay.
Moving on, and I'm gonna, John Balaciano.
Can you hear me?
Yes, I can.
Okay. Good afternoon, distinguished members of the Aging Committee. My name is John Balaciano, and I am a nursing home resident and the president of the resident council at Apple Hewitt Rehab. I am also the vice president of the statewide coalition of presidents of resident councils. I am here today to express my strong support for three important bills before you: 6774, 6775, and 1176. People living in nursing homes rely on staff and volunteers every day. We trust them to do the right thing. That's why it is important that all employees and volunteers get a proper background check before working in nursing home. We need to know that the people caring for us do not have a history that could put us at risk. This bill would help us feel safe in our own homes. Another one that means a lot to me is being able to go out to eat with my family. I don't go often, but when I do, it is something I truly enjoy. I just love going out to eat at a local restaurant and spending time with my sister. It makes me feel normal and gives me a break from the usual routine. It's really special to have that time together. I enjoy regular food. When we go out to eat, sometimes my sister treats me to lunch, and sometimes I treat her. However, it is becoming more and more difficult to ever get to cover the meal. Restaurant prices have gone up, and even a simple meal now costs a big part of my P&A. Our P&A is all we have to pay for things we need. But while prices keep going up every year, our P&A stays the same. This bill would help by making sure we can afford the things we need. It is more about just the money. It's about dignity, independence, and the ability to participate in the simple joys of life. Long-term care ombudsman program is a lifeline for residents like me. They have helped me, and I know they help many others. Without them, many residents would feel unheard and afraid to speak up. That is why it's so important to make sure that there are enough of them. This bill provides funding so that ombudsman can provide more visits, faster follow-up, and be a stronger voice for residents. I urge you to support these bills because they will make a real difference in the lives of nursing home residents. We deserve safety, financial stability, and a strong voice to advocate for our rights. Thank you for your time and for considering the needs of people like me.
Thank you so much, John, for your testimony and sharing your opinion on these bills, which are so important, 6774, 75, and 1176. You're on the ground there. You know what's going on. You're working with the residents. So we really appreciate your input. Thank you. Is there anyone else that would like to ask a question or have a comment? Okay, seeing none. Thank you very much, John.
Okay.
Okay, we'll move on to Spring Raymond.
Hi, good morning or afternoon, everybody. This is Spring Raymond. I am the president and CEO of Western Connecticut Area Agency on Aging. There's been a lot from several people on Bill 1176 regarding service navigation. So I wanted to fill in on some of the housing questions that arose and just fill in maybe some answers for all of you. First of all, Aging CT is working on the homelessness situation together. On December 13th, Aging CT and the Coalition to End Homelessness met to explore solutions for keeping seniors housed and finding housing for those currently in shelters or living in unsuitable conditions. The numbers for the homeless in 2025 appear higher than 2024, but I'm waiting on final counts from Connecticut Coalition to End Homelessness. As of January 24, their annual point in time count, where they go out and every year at one point and count the homeless, they had nearly 800 over the age of 55 in the state of Connecticut that they were able to count in that one night, living out in without shelter at all. So that pretty much indicates that the seniors constitute about 23% of the state's homeless population. We saw an increase of 13% from 23 to 24, and we're expecting that to go up this year. That being said, the Aging CT is working together with the Connecticut Coalition and we committed to participating in a statewide initiative aiming at educating state agencies about what area agencies on aging can and cannot do while working to eliminate existing barriers. We have a proposed date of March 19th into Connecticut Coalition to End Homelessness, and we're waiting for feedback on that. There was a question about the number to reach a service navigator, that 800 number for Aging CT and to reach service navigation is 800-994-9422. And we can also be reached via the web at agingct.org. And just a note to register for our newsletter under the About section. And that'll keep the community updated. I think the other thing I wanted to speak to is just the saving money for the state. I think Marie covered that pretty well. The service navigation definitely saves money to the state by keeping those with disabilities and older adults in their homes and providing services that keep them out of hospitals and nursing homes. As you heard one of my service navigators, and she's very passionate, and they work very, very hard to make sure that we turn over every rock to find a solution to keep somebody housed. And we work a lot with legal aid. So I just wanted to give a shout out to them for all the hard work they're doing.
Oh, thank you, Spring. Can you tell us where, even if it's anecdotally, where the homelessness is coming from in aging? Are they losing their houses? Are they apartments?
So it's rising housing costs, limited affordable housing options, fixed incomes that can't keep pace with the increased expenses. And the shelter, so I have an example here, Pacific House, which is in Stamford, where 1/3 of the residents are over 55 and with many over 65. The YMCA, I was just there Danbury, it's full of seniors. The shelters that are housing our seniors right now on bunk beds, which isn't the best situation. I'm having it's a very big issue in Western Connecticut, and we've been holding. Many of you probably know those regional leadership breakfasts. We're having one on the 28th of this month again to go with the two concerns being housing and transportation. It's very bad in Western Connecticut, but it's bad throughout the state, and that's why the Aging CT decided to take it on. But we are trying to address it with all of our senior centers, our municipal agents, anyone that can have a voice. I've had several meetings about it, and connecting with the Connecticut Coalition to End Homelessness. We're hoping that we can at least communicate, as you were talking about, how to get the word out. We'll be working with them to get the word out to everyone working within the state about the services that we can provide, what we are able to do. And then there's other things that we figure out, but what are we really able to do to help keep somebody housed? That's our goal, is to keep the seniors in their homes, because that's where we can best meet their needs. Once they're out on the street or living in a tent in their car, it's so much harder to get them services, and it's just a lot more work. So we want to try to help them not get to that point.
I think it's all our hope that we can help them to age in place, but in their communities, because when someone gets uprooted, loses their home or their apartment, and they're moved a half hour away because that's where there's an affordable housing unit available, it really disrupts cognitive thinking. It disrupts everything on a senior person. So doing work like that, but the homeless shelters are like way behind. Housing authorities are 2-3 years with a waiting list. So all the work that you guys are doing to help find a solution to this, I know all of us here appreciate that. Is there anyone else that has a question? Thank you so much, Spring, and I'll now hand it over to Senator Hockadell.
Thank you so much, Representative Garibay. Up next, we have Sean Mastroianni. Do we have Sean?
Can you hear me?
We can. Go ahead, please.
Good afternoon, distinguished members of the Aging Committee. My name is Sean Mastroianni, and I am the Chief Operating Officer at Connecticut Baptist Homes. I'm pleased to submit testimony in favor of the House Bill 6773, an act allowing trained nurses, aides, and assisted living aides to administer medication to nursing home and assisted living residents. I am a licensed nursing home administrator with over 20 years experience in both of these settings. Today, I'm here to discuss the bill HB 6773. This bill will address the multifaceted needs that we seek in our industry. First, we must consider the growing demand for services in skilled nursing and assisted living facilities. Connecticut has the 7th oldest population in the nation. Currently, 19.1% of our population is over the age of 65, and this is projected to be 57% by 2040. This growth will create a significant demand for healthcare workers in both settings to maintain person-centered care and quality care. We must begin building this workforce now to prepare for this anticipated increase in need. Secondly, the consideration and passage of this bill will enhance the experience for staff, families, residents. Allowing medication technicians to administer medications will add another valuable member to the care team. Most medication errors result from timing issues, and this addition will help alleviate this problem. Furthermore, it will benefit residents financially by reducing medication administration fees in the assisted living communities. Third, this proposed bill will create another career path for CNAs. CNAs are certified nursing assistants. It provides these dedicated individuals with a career ladder and opportunity to earn higher wages. We hope that the medication technician role will encourage CNAs to pursue further professional development, potentially leading to LPN or RN licensure. It is important to note that the purpose of this bill is not to solve existing staffing shortages, but to enhance these settings with an additional layer of support for staff. In closing, I would like to point out that Connecticut is the only New England state and one of only 12 nationwide that does not allow medication technicians in these settings. 38 other states already utilize them. Let us move Connecticut's skilled healthcare professionals forward by providing more hope and another career opportunity and preparing for the demands of 2040. As a licensed nursing home administrator, I take my role seriously and believe my primary duty is to advocate for residents. The passage of this bill will help meet their needs, which I believe is everybody's goal that is on this call today. Let us seize this opportunity to enhance the quality of care and ensure our seniors receive the care that they need and deserve. And I just wanted to note, that's my submitted testimony, that some of the testimony prior, some of the issues stated were about assessments. And in other states, this position does not allow them to assess whether someone should be receiving a medication, nor does it typically allow them to give a narcotic. And I'm willing to take any questions anybody might have.
Thank you so much, Sean. Does anybody have any questions? I am not seeing any, Sean, so thank you again for your testimony and have a great day.
Thank you.
Next, we have Emily Kelly from Essex Meadows.
Hello, can you hear me?
We certainly can. Go ahead, please.
Okay, my name is Emily Kelly. I'm a registered nurse and the director of Resident Health Services at Essex Meadows, a life care retirement community and a member of Leading Age Connecticut. I'm pleased to submit testimony in favor of House Bill 6773, an act allowing trained nursing aides and assisted living aides to administer medication to nursing home and assisted living residents. I appreciate the opportunity to speak with you today regarding this bill, an important step toward addressing the evolving needs within our nursing homes and assisted living facilities. As someone deeply entrenched in the field of healthcare services, specifically within assisted living and memory care units, I have about 20 years of experience. I have witnessed firsthand the pressing need for enhanced framework that empowers certified nursing assistants and assisted living aides. The proposed bill, which would allow these trained professionals to administer medications, represents a pragmatic and forward-thinking approach to improving care. Implementing a career ladder advancement program for CNAs would not only elevate their skills and responsibilities, but also foster career growth. It is important to emphasize that this initiative is designed to support, not supplement, the crucial role of the registered and licensed nurse. Allowing CNAs to administer certain medications, for example, routine eye drops, patches, topical creams, addresses both practical and economic issues. It alleviates the unnecessary cost burden imposed on residents who are incapable of self-administering such medications, while ensuring that professional nursing staff are utilized where their skills are most needed. Enabling CNAs to take on the responsibilities contributes to greater staff satisfaction by promoting and providing new challenges, opportunities for professional development. It addresses the workforce shortage by making the nursing aide role more attractive and rewarding, ultimately contributing to better quality and safety outcomes for our residents. The growing aging population highlights the need for adept medication management. Ensuring well-trained CNAs can safely assist stable residents within a non-acute setting not only benefits individual care facilities, but also supports the broader public health goals. The bill's provision for this certification to remain permissible respects the autonomy of facilities while offering a flexible solution tailored to diverse operational needs. Many states have already successfully adopted these similar models, providing a wealth of best practices to draw from. I personally feel that House Bill 6773 is an essential move toward modernizing care systems and enhancing the efficacy of medication administration and aligning our workforce capabilities within the realities of the demographic change.
Your 3 minutes are up. Please summarize.
I ask the members of the legislature to support this bill, paving the way for a more responsive and sustainable healthcare environment. Thank you for this opportunity.
Thank you so much, Emily. Are there any questions or comments? I'm not seeing any from the committee, Emily. So again, thank you and have a great day.
Thank you.
Next, we have Valerie Boucher. We have Valerie Boucher. Mr. Clerk, do we have Emily in the waiting room?
There are 3 Valerie Boucher Bouchers.
Oh boy.
I'm not sure which one is the correct one.
Well, the real Emily or Valerie Boucher,
Maybe
please.
the one with the silenced microphone. The other 2 don't have anything. Oh.
I have unmuted all of them, so one of them should come forward to speak if they are here.
Let's do this. Let's go on to Donna Bernier, and we can come back to Valerie. Is Donna here?
Good afternoon. Can you hear me?
We certainly can. The floor is yours.
Wonderful. So good afternoon, Senator Hockadell, Representative Garibay, and the honorable members of the Aging Committee. My name is Donna Bernier. I live in Brooklyn, Connecticut, and I am the Vice President of the Nursing Home Division at the Service Employees International Union 1199 of New England. I come here today to testify in opposition to House Bill 6773, an act trained nurses, aides, and assisted living aides to administer medication to nursing home and assisted living residents. SEIU 1199 New England represents nearly 7,000 nursing home workers across the state of Connecticut. Over 5,000 of those members are certified nursing assistants. While I'm currently the vice president at 1199, I have worked as a CNA for 15 years in a nursing home. Nursing homes in Connecticut are massively understaffed, resulting in nurses and CNAs being asked to care for more and more residents with increasing levels of acuity. The vast majority of the direct care that takes place in nursing homes is administered by the CNA. They help their residents eat, bathe, move about, and ultimately live a normal and dignified life. However, with the current staffing levels, CNAs struggle to meet these demands in a timely manner, leading to poor quality of care for residents. This bill would only make the administration of quality care even more difficult. We cannot ask our residents to do we cannot ask our CNAs to do yet another task. They are stretched as thin as they can be. If we want to improve the administration of medication to residents, we need to hire more LPNs and make it easier for CNAs to become LPNs. We should not seek to save money by undercutting our CNAs' ability to do their job. If we take shortcuts like having unschooled CNAs administering medications, we are asking for poor outcomes for residents or worse. The administration of meds to patients requires an in-depth knowledge of their intended effects and expected outcomes and adverse reaction. This bill does not provide clarity as to what types of medications the CNAs will be handling. Many medications require dosage adjustments and monitoring, consultations with physicians, and prior assessments before being administered. Are we going to ask our CNAs to take on that role too? Many of the medications our residents take involve high risk, from blood thinners to anti-diabetic agents, chemotherapy drugs to sedatives. Medication errors can quickly prove harmful or even deadly. These are not tasks that they are trained for and should not be added to their workload. CNAs are already overworked and unable to provide quality care with their current assignments. Please vote no on House Bill 6773. CNAs in Connecticut are struggling to provide the care that their residents deserve, and this bill will only make matters worse. Thank you for your time.
Thank you, Donna. Does anybody have a question or comment? I am not seeing any, so thank you for your testimony and have a great day.
Thank you. You too.
Is Jedediah Henderson here? Jedediah? Great name.
He's not in the waiting room, and there's nobody else in the committee room.
Okay. How about Michael Furlow? Michael Furlow?
Same.
Okay. Mary Beth Semino.
I'm here.
Go ahead, Mary Beth. The floor is yours.
Good afternoon, Senator and representatives and honorable members of the Aging Committee. I'm Mary Beth Semino and I live in Wallingford. I'm a certified nurse's aide at the Arden Care Center in Hamden. I'm here today to urge you not to approve the House Bill 6773, the act allowing trained nurses' aides and assisted living aides to administer medication to nursing home and assisted living residents. I've been a CNA for 45 years. It's been a lifetime commitment. I've entered healthcare after taking a course in high school because I love helping people and it gives me a purpose. But over the 4 decades on the job, the patients we have changed significantly. Gone are the days of caring for the solely sweet little old ladies in the nursing home. The oldest one I've ever taken care of was 1 month shy of 115, Mary Bidwell from Madison, Connecticut. Now we have residents that are in their 30s and 40s and up, and we handle patients with mental health issues, drug dependency, and alcohol withdrawal. The level of acute care monitoring required is never been higher. Despite this, staffing levels are critically low and inconsistent. Some days we may have 12 patients. On other days, we may have 17. This depends on the shift because if you're on the 11 to 7 shift, there can be literally 1 CNA for every 30 residents. The residents on the rehab wings keep us running all the time, while others are struggling on other units and even sometimes rehab, but mostly the dementia units, the locked units, with sundowning, needing extensive care to settle them down. Adding med passes to our already exhaustive list of responsibilities will only compromise patient care. This bill creates unrealistic work demands that will force CNAs to cut corners, degrade care quality, leave their jobs, and ultimately put patients at risk. Passing the House Bill 6773 would be detrimental to our facility staff and most importantly, our patients. When staffing shortages and budget cuts already compromise the quality of care, now is not the time to add more to our workload. I strongly urge you to reject this bill. Thank you for your time.
Thank you so much, Mary Beth. Are there any questions or comments? Yes, Representative Garibay. You're on mute. Thank you.
I think I just got it off. Thank you so much for your testimony and for so many years dedicated to our seniors. So this bill is not intended to burden CNAs. It's actually to give them a higher salary and a pathway, et cetera. And I truly believe that both our nurses and our CNAs are overburdened in, in the care of our seniors. I am curious, and you may not know this, and maybe someone else does, but 1199 SEIU in Massachusetts supported the same exact bill. What is the disconnect, or why? Do you know that?
I am not aware of that. Donna actually might be able to talk to you about that, but I'm thinking that maybe the way it was written, because as a CNA, I can't take care of 10, 8, 12 people, do their care, physical therapy, get them to, those appointments, make sure they have lunch and pass meds and document. Can't. I can hardly finish my work now.
Right. So we know that are doing this, that a bill is always in progress with many changes. There's many thoughts being given to non-medical medicines, certain things from what we hear is happening in nursing homes about insulin not being given on time or certain things. So it comes from a good place, and we're happy to hear, and I'm not going to take up the time here, but if someone could get back to me on that, I'm just curious, and it can be the way, but again, we can change language. We can, do many different things. So I look forward to hearing from someone on that.
Thank you.
Thank you. Mary Beth, you also have a question coming from Representative Hughes.
Thank you, Madam Chair, and thank you, Mary Beth, for your testimony. I wanted to clarify, are you saying that you feel like the CNAs would be mandated to do this if they opted to take this pathway to an increased stepped responsibility and pay?
I'm not sure exactly what you mean.
Well, the language of this bill is that it's an option. It is not a mandate at all for either CNAs or for the nursing homes to then require this.
I can't think of one CNA that would do this and do a regular workload assignment. I also worry about insurance. If you pass the wrong meds, who's responsible? I worry about the training and how long it takes, and who is actually going to be qualified to do this on top of all the work they already have. I mean, there's a lot of concerns.
I understand that. I worked in the DDS field where we had this medication administration certification program. And so there is a training involved, absolutely, and a test and a renewal training. And, you have to renew it, that certification. It does fall under the license of the home and DPH and the nursing supervision, because you are simply administering the medication, usually from blister packs or whatever, that the nurse has, authorization for. So I just want to make sure that your testimony matches the proposal that we have before us today, which is basically to align the workforce in the nursing homes with what is already available. Like I said, this very state certified medication administration certification program in some of the other settings.
So I think we need to address first the staffing and the staffing levels, because if we can't get CNAs into nursing homes now, you're going to take them to do more work. It's not going to work. It's just not. We don't have the time. We don't have the staff. You have to address one issue first. Get CNAs into the building. How do you do that? Sit down and talk with us. We will tell you how. If the job is not enticing, just by passing meds and taking care of 20 patients is not going to work. You might get more to leave.
I understand. It's very, very much intertwined with the staffing levels and the staffing burdens. Thank you, Madam Chair. I have no other questions.
Thank you very much. Any other questions or comments? Seeing none, Meredith, thank you so much for your testimony and have a great day.
Thank you, you too.
And I'd like to just circle back really quick to see, I saw Valerie raised her hand a couple times. Is Valerie Boucher on the list again? Don't see her now. Okay.
Valerie, if you are here, can you raise your hand in the waiting room again so I know which one is the correct one?
Let's try Jedediah. Is Jedediah Henderson here?
No, he is not here in the waiting room. So, oh, here we go. Now I have a Valerie raising her hand. So let's see if this works.
Okay. Is this Valerie?
No, this is Michael Furlow.
Oh, Michael. Michael, go ahead.
Yes, good afternoon, Senator Hockadell, Representative Garibay, Senator Huang, and honorable members of the Aging Committee. My name is Michael Furlow. I live in Hamden. I am a licensed practical nurse, and I strongly urge you not to pass House Bill 6773. An act allowing trained nurses, aides, and assisted living aides to administer medications to nursing home and assisted living residents. This bill will not make my job easier. It will make patient care more dangerous. The certified nursing assistants I work with are the backbone of the facility. They ensure that residents are fed, bathed, and comfortable. I depend on them so I can focus on medical care, address new health issues, ensure medications are balanced and correct, carefully review charge, usually multiple times a shift, to catch potential side effects. Our CNAs are already stretched too thin, assigned to more patients than they should be because facilities keep cutting corners, increasing workloads, and deliberately short-staffing the units, pulling them away from the essential, compassionate care that residents will depend on. You can't keep piling on more responsibilities and expect them to do so safely. Instead, let's focus on real solutions. Help CNAs further their education so they can become LPNs and RNs. Enforce safe staffing levels to ensure proper patient care and address supply shortages. Our staff should not have to buy ibuprofen, Tums, and diapers with their own money just to meet patients' needs. Passing this bill will put lives at risk. CNAs will leave the field, will leave the facilities, resident care will suffer, and ultimately, our worst fear is that someone could die. Please vote no on House Bill 6773. Thank you for your time.
Thank you, Michael. Are there any questions or comments? I am not seeing any, so again, thank you and have a great day. I am going to go on to Maureen McIntyre. Is Maureen here? Maureen, go ahead.
Thank you very much. Good afternoon, co-chairs Hockadell and Garibay, vice chairs Miller and Fortier, and ranking members Wong and Representative Belinsky. My name is Maureen McIntyre, and I'm presenting testimony in support of SB 1176. Just when you thought you were all done for the day, I'm so sorry about that. On behalf of Aging CT, I would like to start by thanking you again for your support of and belief in our concept of service navigation. We had envisioned the service navigators to be bridges between state agencies, conduits between healthcare and social services, partners with our colleagues across the aging and disability sectors, supports for municipal social services, and lifelines for consumers who may otherwise fall through the cracks. We are so proud to be back here today with proof of our concept and to request your support in building upon the success of what has been started. We are also so grateful for the testimony of our colleagues from across the aging and disability networks who helped to illustrate the needs and the intersectionality of those needs so beautifully throughout the day today. We were hoping that one of our consumers would be here to present his story. Unfortunately, today is a physical therapy day, and he relies on his friend for transportation, so his presence was not to be. Like many of the client stories you've heard today, our consumer, Mr. M, needed help with housing. I'd like to take a minute just to quickly point out that it is by no means an accident that the new service navigators we are requesting will focus on housing. Spring Raymond spoke very eloquently about this earlier, because our hope is that building on these partnerships, we can better address some of the upstream causes of homelessness in the elderly, as you mentioned earlier, Representative Hughes. In the case of Mr. M, he'd done his due diligence and worked through the process, but it was very frustrating and he grew very disillusioned at his prospects. Like those that have testified before me, our service navigator helped to create order out of the chaos. She allowed Mr. M to be heard and assured him that he would not be lost in the wilderness, not on our watch. We asked him ultimately if he found the service helpful and asked if we could share his comment with you. And he said yes. For senior living for people who have worked their whole life, once you become a senior or disabled, you just don't seem to get the help you need. You just don't want to see seniors become homeless. To save time, please enjoy the excerpts below in the letters and emails received at our office in my testimony that I've provided. For each one of these, there are many more, and they all speak to the need for this level of assistance and the terrific impact that service navigation has made on Connecticut residents. Thank you so much for your time and your consideration of SB 1176, an act concerning funding for the Office of the Long-Term Care Ombudsman and Area Agencies on Aging Service Navigators.
Thank you so much, Maureen. Does the committee have any questions or comments? Seeing none, we thank you again, Maureen, for your testimony, and have a great day.
For having me.
Of course. I think last but not least is Joanna Bramer. Alex, do we have a Joanna?
Hello, can you hear me now?
I can hear you now. Go ahead.
Great, thank you. Good afternoon, everyone. I am the Finance Director for the North Central Area Agency on Aging. I like to provide a legislative testimony which does not generally fall within the realm of my capacity. In fact, I don't have any interactions with consumers until recently. I happened to be in the office in the afternoon after hours when a gentleman came to drop off supporting documentations for his circumstances. He inquired if I spoke Spanish, and suddenly we engaged in a lively chat about himself, his career spanning over 40 years working in Connecticut, his retirement, living in Florida, his family, then relocating back to Connecticut because apparently Florida just wasn't his thing. He was 82 years young, so full of spirit and vitality. The man could have gone on for hours talking. It was just really a great conversation to have. For me personally, I just recently lost my grandfather and he was 92 years young. And I mean, to be able to speak to another gentleman at such an advanced age, it was just welcoming. And I appreciated his time. Mr. X, as I'll affectionately refer to him, he commenced working with one of our service navigators because of housing issues and a landlord not accommodating his needs. While his housing circumstances were his frustrations, his eyes, demeanor lit up with gratitude speaking about our service navigator. He proceeded to praise her for their patience, her caring personality, her respectful nature, and continuous follow-up addressing his difficult housing circumstances. He's an example of someone who's seemed pretty self-reliant, but when he needed assistance, he contacted us, and our service navigator knew what to do and how to help. It was so nice to hear from someone who receives our services as opposed to just names across the paper, because that's just generally what I would typically see. Reflecting now, I was so proud of NCAAA. I was so glad to share my encounter with not only the service navigator, but her supervisors, because I felt it was important to let her know she was appreciated. Sometimes we can get so engrossed in our work, having challenging days, when there's that one chance encounter where a stranger can affect you and remind you the work that you do is important to others. Thank you very much for your valuable time listening. I hope to have your favorable consideration in support of SB 1176.
Thank you so much. Are there any comments or questions for Joanna? I am not seeing any, so thank you so much again and have a great day.
Thank you as well.
Mr. Clerk, have we exhausted the list of participants for this meeting?
Do you want to give Valerie one more shot?
Sure.
Okay. We'll
Is
see
there a
if
Valerie in the house?
we'll see. Or if it's Jedediah, I'm not sure. There's now 4 different people named Valerie in the waiting room.
Oh
So
my. Okay.
I just gave permission to the one with their hand raised. So
Okay.
Hello.
Could somebody state their name?
oh, they left after.
Oh.
Oh, there you go, Jedediah. Let me. Oh my God.
Hello.
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 Is this Jedediah?
Yes.
Go ahead, Jedediah. You have the floor.
Good afternoon, Senator Hochschild, Representative Gerby, and honorable members of the Aging Committee. I'm Jedediah Henderson. I live in New Haven. I'm a certified nursing assistant, and I'm here to say you should not pass House Bill 6773, an act allowing trained nurses aides and assisted living aides to administer medication to nursing homes and assisted living residents. I've been a CNA for 4 years after moving from home health care to a nursing home setting. I made the change with hopes of helping more people. However, I've encountered a unique population and patients I didn't expect. Many of them are homeless, recovering from addiction, and can be very difficult to work with. It's not what you expect in these type of settings, but I've learned to adjust. An average day involves me seeing a dozen patients, but that workload varies. Some days it gets as high as 20, as if the patient workload wasn't enough. We're also picking up duties of several jobs that the facility continues to leave unstaffed. We act as the dietary aid for meals, we're the smoke aid for when our patients need to go outside for a cigarette, we're the receptionist at times answering the phone and doors. Adding another task, and one as important as passing medication, will be asking for mistakes to happen. I once again ask you to please vote no on House Bill 6773. We're already understaffed enough and additional tasks on our backs as CNAs could just spell disaster. And thank you for your time.
Of course. Thank you. Are there any questions or comments for Jedediah? I am not seeing any, so thank you so much for your testimony and have a great day.
You too. Thank you.
Thank you. Okay, Mr. Clerk, is there anyone else for us?
I believe we are all set.
Thank you so much. And I really want to just thank everyone for attending and being flexible with technology and being safe. And we just wanted to make sure that we were able to have this public hearing today. So thank you to everyone. And if anybody has committee members have any issues, please remember to bring them forward for our next screening meeting. And with that, I will entertain
I'd
a
also like
motion.
to thank everybody for
I'm
being
sorry.
today and, just weathering this through and everybody's patience and comments and good questions. So thank you.
Thank you. Is there a motion to adjourn?
So moved.
Is there a second?
Second.
All those in favor, say aye. or way that they run the two. Thank you so much. We are adjourned.